Good evening, councillors, and welcome to this full council meeting, Tuesday the 7th of July, in the Town Hall in Enniskillen. We have 5 councillors online. Can I remind councillors, please, if you can put your camera on? Thank you. So just before I take apologies, I just want to mention the sudden death of Dr. Tom Frawley, who was CBE Chair of Western Health and Social Care Trust, and acknowledge his exceptional leadership and unwavering dedication to the Trust, which had a profound and lasting contribution to patients, staff and the wider community. Tom will be remembered with great respect and gratitude for his compassion, wisdom and commitment to public service. And for Manoroma District Council, send our thoughts and heartfelt condolences to his wife, Marie, his children, Rachel, Joseph, Daniel, and the wider family circle at this very sad time. I'd also just like to acknowledge that John News, this I think is going to be John's last, although he'll be at the meeting tomorrow, this is going to be his last full council meeting. So I'm sure everybody here will agree with me and wish him, been enjoying working alongside you, John, and wish you all the best for the future. And so we now go to apologies, and I think we've got 2, Stephen Donnelly and Garvin McPhillips. And I'll go to Dermot.
Thanks, Chair. Yeah, 2 apologies from Sinn Féin, Councillor Glenn Campbell and Councillor Patrick Withers. Thank you.
Thank you. Councillor Warrington.
Just the mic, Chair.
Oh yeah, sorry, I forgot to do that.
Councillor Mark Alphins and Councillor Irvine will be running late. Thank you.
Okay, thank you. And Councillor Robinson?
No apologies, I think the rest of them was online there.
Okay, are you sitting in the wrong chair, Paul?
Yeah, that's wrong.
Okay.
I've muted my mic.
Thank you. And Councillor McGrath?
Councillor Gannon is on his way. He's just on his way from Mumbai. I went to the wrong place. So
thank you. And Councillor Ruth?
Just the mic, Chair. Just Eddie's mic.
Oh, this is annoying.
You can talk. Yeah.
That's it.
Sorry, just an apology for Councillor Donnelly.
That's okay. Lovely. Thank you. Okay, so item 2, to confirm and sign minutes of the special council meeting held on the 18th of May. They've already been signed noted, or we go for it? Okay, so for accuracy, page 1, page 2, 3, 4, 5, and there's nothing on 6. Can I have a proposer and a seconder, please? Councillor Little and Councillor Warrington, thank you. All agreed?
I don't think Councillor Warrington's in attendance at that one, Chair.
All right, sorry. Can we have another seconder, please, who was actually at that meeting? Rosemary, thank you. And just to confirm the minutes of the annual meeting now held on the 1st of June, page 1, page 2, 3, 4, 5, 6, 7, 8, 9. No, we're not doing. Oh, right, yeah, okay. Yeah. So you're going to propose, thank you. Second, Little, yeah. Thank you. So declarations,
The council meeting chair of the 2nd of June, so item 4.
oh yeah, sorry. I will get used to this, folks. In a year's time, right, okay. The council meeting held on the 2nd of June, page 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, and 24. Can I have a proposer and a seconder, please? Anne-Marie Donnelly and Councillor Robinson. Thank you. All agreed?
Sorry, Chair.
You Councillor Mahon, chair indicating online, sorry.
Oh,
Yeah. So, okay.
oh, you can speak. Okay, okay. Go ahead,
Okay.
David.
Sorry, Chair, thank you. It was page 21. Sorry, you skipped on me there a wee bit. I'm not sure if I'm in the right section or not. 16.3, during that recorded vote, unfortunately, I pressed the wrong button. Now, I'm aware that vote won't be changed, but I'm not sure if it can be recorded that I did press the wrong button, if that's possible. Maybe not at the stage.
This matters arising, I can-
Yeah, we can deal with that under matters arising. That's okay.
Thank you.
Thank you.
So, declarations now, chair.
So we now do declarations of interest. Tommy?
Chair Gormagat, 8.3, item 4.6 as Director of Bid.
Councillor Mahon online.
Councillor Mahan, are you
Yep.
declaring interest yet?
Yeah, item 36, Chair.
Okay, thank you. No others? Okay. So matters arising from the special council, page 1, 2, 3, 4, and 5.
Chair, just to note, there were a number of actions for Northern Ireland Water to come back to the council on. We haven't received a response to any of those yet, and we'll obviously forward the responses when received.
Okay, thank you.
So now you're on your annual meeting.
Yep, the annual meeting now on the 1st of June, matters arising, page 1, 2, 3, 4, 5, 6, 7, 8, and 9.
This is Councillor Bryan now, Chair. Councillor Bryan wants to.
Oh, yeah. Done it?
Thanks, Chair. Yeah, I just want to propose to nominate myself to replace Councillor Patrick Withers on the Capital Oversight Group, and also to replace Councillor Little on the Health Committee, Health and Social Care Subcommittee.
So, Councillor Bryan, is that also Councillor?
That, yeah,
Councillor Bryan,
yeah.
both places? Okay. That's fine.
That's fine. Thank you. Now we'll go to the full council meeting for matters arising, page 1. 2. 3.
Page 3, Chair.
Yep.
Chair, just on page 3, members, we've 2 letters on item 4.3, care in the community. So the first is a response from the Minister of Health acknowledging, I suppose, the challenging environment around care in the community and the complexities in the situation. The second letter, we had posed 2 specific queries to the Western Health and Social Care Trust. One was in relation to whether there was a directive around patient care in terms of corridor care, and secondly, the number of patients who were discharged without having a full care package in place. So they have confirmed there is no such directive, Chair, on the first paragraph of the letter, and then 67 patients were discharged without having either with a partial or no package of care. So both in response to previous council correspondence.
Thank you. Councillor Hayes?
Yeah, thank you, Chair. I'm happy to propose to note those letters, and just wanted to make a comment on those about the care in the community. The letter from the Department of Health. Just to note, I haven't had a letter back from the Minister on the occasion of the emergency density clinic yet, have we not? No. Okay, that's a shame. But anyway, the care in the community, it states in the letter that the current model is resource intensive, significant financial input, and there is a need to move away from traditional concept of domiciliary care towards approach that actively supports care in people's homes. It mentions the 10-year strategy and the 3-year delivery plan. And I'm just noting in there that in the strategy, priority 1, it says it's choice of services, providers and guidance on how funding works, which means directing their own support, having direct control of their social care budget through direct payments and trust manage budgets, therefore making it easier. I would actually completely disagree with that. This actually puts the onus on the patient to arrange their own care. Direct payments is an incredibly complicated system. It requires them to become an employer with all of that entails, and it have to open a separate bank account for this purpose after actually sourcing a service provider. This is putting really unnecessary barriers up to care. When all they want is someone qualified to come in and help them in their own home a few times a day to enable them to stay safely at home. I really would like to propose that we write back to both the Minister and the Trust to look at possibly start to moving this in-house because the Trust is paying outside agencies, and this isn't a slant on the agencies or the carers at all, but they're paying outside agencies who employ carers on normally around a minimum wage. And let's be honest, quite large amounts of profits are being made out of that. It will also fund in the Centre for Independent Living, again, great service, but that's to advise people how to do the direct payment system. All that funding, I think, should go back into the Trust and employ our own carers. You know what I mean? And a lot of emphasis is put on choice. That's fine, but in my experience, there is huge, significant queries about care packages. People just want a qualified person to come and look after them in the house. Maybe it's once a day, 4 times a day. We've all seen reports on the news of that poor lady, albeit it wasn't in this district, that's lost her evening care and has been put to bed in the afternoon, and in her words, with sleeping tablets. That's outrageous. And I think that this strategy, priority 1 of choice of services and providers, I really think that's going in the wrong direction. So I propose that we write back to the Trust and the Minister just to set out those points and to see if we can maybe move away from that and bring it in-house. Thank you, Chair.
Thanks, Nolene. Do we have a seconder for?
Coming in, Chair. So
Oh, do we listen to them first? Right, okay. Sorry, I'll get it right way round soon. Councillor Gannon?
Thank you, Chair. And just to, in particular, comment on the letter regarding care packages. That's so 67 patients in the past year discharged either without a care package or a partial care package. Now, the exact breakdown isn't given there, so we don't have the specific numbers, but 67 is still a really significant figure for me, because that's 67 families. They're having to change potentially their whole way of life, because the adequate support that a person needs just isn't being provided. And yes, sometimes that's fine, and sometimes the family want to give and can give that time, but sometimes they can't because they have other dependents, whether that be children or other relatives who they already give care to, which is often the case. And the people I've spoke to about care plans and care packages in over many years now have all came back with the same thing: the stress and strain it's putting on them and their family to be able to step in when the service isn't being provided in full. And I think more action is needed on it. So I'm happy to second Councillor Hayes' letter, but I'd also ask if Councillor Hayes is content, if we could ask a question about what steps are being taken to bring that 67 number down, what is proactively being done, because really it does have a huge impact on people, Chair. Thank you.
And will you also second the noting of the correspondence? Thank you. And Councillor Ruth?
Thank you, Chair. If possible, if we could have a bit of leeway based on the Department of Health's letter there. I had asked the Council to write to the Department of Health regarding requesting the Health Minister to request from the Western Trust a plan for restoration, what it would cost for the restoration, and then the ongoing annual cost. I don't believe we've got a response to that. I think it's maybe about 3 months or so at this stage. So I would ask if we could also write to the Health Minister based on that for a response, because it is overdue at this stage. Thank you.
Okay, and can we have a seconder for that, please?
Yeah.
Councillor McGrath.
Do you want to just check with Councillor Hayes if she can hand to ask that query within her letter, and then Councillor Deehan online?
Okay, and you're happy with the extra route from Adams? Yeah. And Josephine?
Thank you, Chair. Well, at the outset, can I too please add my voice of thanks to John Hughes for all the work he's done for this council, and to wish him well in the future. In relation to this point, I wholly support Councillor Hayes' proposal, Chair. There is a recognition by the Department of Health that it is absolutely imperative that adequate domiciliary care packages are put in place to support discharge of elderly residents from hospital. And there is a great deal of concern regarding so-called bed blocking. I don't like that term. I mean, elderly people who are in hospital don't want to be in hospital. They want to be enjoying the comforts of their own home, but they simply do not have the care packages in place to support them. And as we've discussed in previous meetings, rural areas are particularly challenging to find carers to support elderly residents in their own home. So this is something that needs to be sorted. I can tell you that as part of the neighbourhood model of care, and in particular with the formation of the integrated neighbourhood teams, the Minister of Health is focusing very much on trying to reduce the length of stay of elderly people in hospital when they could be discharged. So there will be a focus on this. I don't know what the answer is. I agree with Councillor Hayes that carers need to be valued, and they need to be paid at a rate that is commensurate with their care and the responsibility of their posts. So I think that we need to get all the agencies together, the trusts, the Department of Health, social services, and try to find a solution to this difficult issue, Chair. Thank you.
that letter. So you've everything concluded there, just proposer and seconder. Councillor Hayes had proposed, Councillor Brown seconded, and all agreed.
Okay, so we've had proposals and which has been proposed and seconded. Is everybody in agreement? Okay, thank you.
Thank you, Chair. Just also on that page, item 4.4, we have a response now from the Chief Dental Officer, and members will recall that we had written and suggested a joint meeting. So the Chief Dental Officer has advised it wouldn't be appropriate to meet alongside the trade union body, but then sets out the various measures that are in place, and I suppose specifically the recent announcement of the additional 8 million and the allocation of that. Chair, members will be aware from last month's meeting that we do have a date of the 22nd of September for the meeting with the British Dental Association. I'm not sure whether the Chief Dental Officer will meet separately. I think it's possible. So I'm not sure if that's something that members would like us to pursue.
Thanks, Alison. Nolene?
Thank you, Chair. Yeah, happy to.
Sorry, Eddie. Go on ahead,
Okay.
sorry. Yeah.
I'm happy to propose and note the correspondence and thank them for their response. I was just curious, and I was wondering, as I don't know if we're going to be proposing a meeting with the Chief Dental Officer, Caroline Lappin, but in the instance that we're not, could we possibly just write back and ask, because she does say that she doesn't have any involvement in policy, but she's fully involved in addressing the current concerns affecting access to health service dentistry and to the Minister. I'm just wondering, has she, in her capacity, stressed to the Minister the crisis of access to NHS dentistry at the moment, and specifically the need to reform the current payment model, because that's what the Dentists Association told us is the issue. Obviously, the extra funding is welcome. The emergency dental clinic will be welcome wherever it, would like to know a little bit about where it's going to be. But if that current payment model isn't changed and updated so it makes it worthwhile for dentists to take on NHS pensions, then all the funding in the world, they're not going to take any more NHS patients. So I was just wondering if we aren't meeting with her, could we write back and just ask that specific question, please, Chair? Thank you.
Are you proposing that we do write back for a meeting with her separately? Yeah?
Yeah, could do. Yeah, I'll propose that now. Thank you.
Okay. Thank you. Councillor Ruth?
Thanks, Chair. And yeah, I think it is good to have the meeting. I think her issue was having the meeting at the same time with the union, and look, I can accept the reasoning behind that. But I think I would second the proposal to arrange a meeting, preferably after we have met the union. So if there are any concerns that they have themselves, we can at least in some way lobby on their behalf to try and get some action based on that.
Yep. Okay, thank you. Seamus?
Yeah, I would like that we'd also write either to the Minister or this person, Caroline, to find out, I don't know, maybe the Chief Executive will be able to guide me on this. Where would you get the stats on the amount of places per capita? Because I suspect that there is an awful shortfall west of the Ban and in Fermanagh in particular, or this council area in particular, that we are really at a rural deficit here in the amount of dental provision there is for people for national health care dental, because people I'm talking to cannot find anywhere to sign up to National Health Service dental treatment. There's just and more of them is closing. So can we find out the stats as a comparison, whether by council area or whatever per capita, so that we can get the figures? We need to dig down into these figures, because I think we're being really let down in this area. So I propose that.
Okay, thank you. We need somebody to second that. Councillor O'Reilly, thank you. And everybody, we've had 2 proposals. Is everybody in agreement? Yep. Okay, thank you. Is that everything on page 3? Yep. Page 4.
Chair, Chair, just the bottom of, page 4 into page 5. This relates to the discussion at last month's meeting regarding the proposals around fireworks displays in Enniskillen. So we had a couple of actions to do. So just to confirm that in the intervening period, Enniskillen Bid have been in contact with the council. They've requested that they would wish to rescind their letter of offer for £15,000 and that they will seek alternate sources for funding for the Fright Trail exhibition and those elements that they had submitted to us. So the proposal therefore, Chair, would be in light of that we would proceed just now to advertise for an expression of interest for a Halloween programme in Enniskillen to include fireworks. That would be the same model we put in place for Omagh, up to a maximum of £25,000. Clearly, any organisation would be able to bid for that. That would be the proposed course of action and no rescinding motions or any other action required.
Thanks, Alison. Dermot?
Thanks, Chair. Yeah, I'm happy to propose that course of action, and I think once the uncertainty around the funding for the fireworks this year became an issue, I think it was appropriate that the council stepped in and ensured that that fireworks display could go ahead this year. I think it's a hugely popular event and brings a lot of people into the town, and it would have been really disappointing for reasons beyond our control that it wouldn't have happened this year. So I'm glad that we are taking that step and we are going to ensure that it goes ahead this year. Thanks, Chair.
Thank you. Can I remind all councillors online to please put your camera on? Councillor Gannon?
Thank you, Chair, and I'm happy to second the proposal. I think it's great that we finally made some progress on the issue of fireworks here. The benefits to the business community is huge. It attracts so many people in, and people do genuinely love going to the fireworks. That's seen by the crowds of people who attend it. And it is good to finally see that some of the parties who have opposed funding for fireworks for many years have U-turned on this. It's beneficial. Hopefully this is the start of how we can work towards a longer term position on this, but I'll leave it there, Chair. Thank you.
Okay, Alison's going to come in now.
Chair, I think it's important just we keep everything accurate for the record. So at no point was the council asked for funding for fireworks for Enniskillen. So there was no rescinding or no turning of position. What we have had in the intervening period is a request by Enniskillen Bid to rescind their sponsorship. So I had mentioned at previous meetings, at no point had we been advised of a difficulty. Following the council meeting in June, we were advised formally by Bid of a difficulty, and a facility has been put in place to accommodate that. So I think it's just, while I appreciate there will be different views, at no point were we asked to provide funding for fireworks by Enniskillen Bid.
Thanks, Alison. Eddie?
Thank you, Chair, and yes, welcome this. I would commend all the parties here that when this issue arose, that we worked together as a group and have brought a bit of balance back to the funding for Halloween. I take Alison's point on board regarding the council's position on that. I think possibly what Councillor Gannon is discussing is some of the councillors in here's position on fireworks, and yes, it's good to see that we've managed to get to some form of solution long term, hopefully over the coming years. Thank you.
Thank you. And Victor?
Yeah, again, welcome any progress in this. We had obviously quite a wide cross-party meeting with Bid and seen the stats that they provided for us, and it showed how beneficial that these fireworks are for Enniskillen going forward, and I'm sure the same will come out of Omagh this year. But the figures which Bid presented to us on the night was very was very encouraging, and certainly that we do what we have to do to make sure that this event goes ahead. And, you know, again, we will look at it if we're all here in future years. But can I just ask the question, where are we now with this? Do we have to do a rescinding motion, or is everything in place basically? Because we don't want, obviously we're in the summer period now, July and August, and we don't really want it going over to September, and then we'll hear that there's no time now to sort anything out. We don't want that problem.
Sorry, Chair, I thought I'd clarify that. My opening comments, happy to do so. No, so we don't require a rescinding motion because the applicant who had received funding for an event not related to fireworks has asked that their letter of offer essentially be rescinded. So no new decision is required by the council in that regard. The only decision now is to proceed for an expression of interest process, which doesn't conflict with any previous decisions, and therefore no rescinding motion is required. So in terms of next steps, Chair, obviously we'll have the call-in period valid from the council tonight, but there on the expiry of the call-in period, we are able to action council decisions accordingly.
Okay. Aaron?
Thank you, Chair. And again, welcome the development tonight, and echo most of the comments from across the chamber, and hope that this maybe proves going forward that a bit of more dialogue between all parties involved will prove beneficial. So thank you, Chair.
Thank you.
Okay.
You need to prepare.
No, you haven't.
Yeah, you have rewards. Yeah.
Thank you, Chair. Chair, just then on item 4.7, members, a reminder that we do have the meeting with Invest Northern Ireland tomorrow at 11 a.m. hybrid, but in the base for the meeting is in the Grange in Omagh. Just to advise that today we have received two related items of correspondence, so they're both in your other folder. The first is from the Western Regional Manager in relation to the recent investment decisions, and then the second is the more substantive briefing for the Council. So that really is going to be the detail that Invest NI will work through with you tomorrow, but they wanted you to have sight of it in advance. So I'm just proposing at this stage, Chair, that both would be noted, and obviously room for discussion tomorrow with the Invest team.
So can we have a Thomas and Marty? Thank you. And all agreed? Yep. Good stuff.
Thank you, Chair. And just also on that page, we have 4.8, we have a response from the DAERA Minister. This is in relation to the wind blow buffer guidance. So we had gone back again around the planting regime in and around power line corridors. So the Minister has advised that he's satisfied that the reconstitution scheme for wind blow does not include or specify guidance around power line buffer zones. And they've gone further around the tree corridors in the latter part of the letter. And then the second letter, Chair, is from the Chief Executive of Forest Service. This was in relation to the clearance work that had been mentioned at last month's meeting around Straduff. So confirming that that's recently been completed and no plans for any further work. And then formally confirming that the responsibility for a road restitution resides with DFI Roads, but they are given a forward work programme for Forest Services activities.
Thank you, Alison. Seamus?
Yes. I suppose, again, this is like civil servant speak, and the Minister is happy enough to put his signature to it. As the Minister full well knows, when he talks about the electricity bill 2025 that's gone through in the south, the Southern Forest Service and relevant departments are going to the new, they are creating buffer zones of 60 metres at the minute. The legislation was brought in an emergency legislation. Now, he says that it's still gone through, and then he goes on to quote that it obviously hasn't been fully passed, but he's then going to say that the existing legislation, and he gives what the existing legislation. He knows full well that that existing legislation's been changed, but he's happy enough for the North to have the existing legislation, the same as the South, which is 20 metres. So I think we should write back to him and point out. He also states here that he goes by best practice in the North. That clearly, the best practice in the North is what they have been doing, which has been a complete disaster when the storms come. And he also states that there's nothing been planted under in the buffer zone. Am I living in the twilight zone, or did a recent reply that we got state that there was planting, but I think some councillor from the far end of the chamber talked that these were these trees that they were planting in the buffer zone didn't grow that tall. So we got some correspondence stating that they were doing that. So I don't know. It's a very mixed message in this, and it seems to be contradicting previous correspondence that we got from them. So I think we should write back and request that they follow the new best standards and best practice that is happening in south of Ireland, and bring them in here as well, because we're just setting ourselves up for another disaster in whatever amount of years' time if we continue on like this. They say that if you keep doing the same thing over and over and expect a different outcome, is a sign of madness. So maybe the era has descended into madness at the minute.
Can we have somebody to second that proposal, please? Councillor John Feely. And all agreed? Thank you. On page 6, yeah. We're going on page 7.
7. Thank you, Chair. Just on page 7, we have a response from DFI Roads. This is in relation, these were the first letters that were sent, just to confirm, on the Struil Shared Education Campus. So confirming, Chair, that there has been some complaints about construction traffic on a number of named roads, and also that they are doing ongoing inspections, and they've referenced minimal evidence of road damage, other than there's small areas around the Glencam Road. So I think the message in this, Chair, it's very much under active consideration by DFI, and obviously it's something I know that members are attuned to. We do have a number of letters from last month's meeting which were specific around restitution of the road, and a response to those is awaited.
Yeah, can we have a proposer and second of that? Bernard, thank you. Somebody else? Aye, thank you.
Sorry, Chair, I just wanted to come in on that.
Oh,
one.
sorry, I didn't see your hand up. Sorry, Josephine. Go ahead.
No, it's okay, Chair. Thank you. You know, I suppose I do welcome this correspondence from DFI Roads, Sean Kearney, who is the network maintenance manager. I welcome it insofar as he informs that the drawing of this material from the Struil Shared Campus should be complete this month. But I have no idea what roads are being inspected, and I would certainly contest his assertion that recent inspection shows minimal evidence of road damage. There is severe, he does refer to edge failure and verge damage, but actually the road is in a very dangerous condition. And during the period where we had heavy rain, the verges were submerged in water. So traffic using the road, particularly the Castleview Road, which adjoins the Old Mountfield Road, they wouldn't have been aware of the depth of the subsidence at the verges, and they would be very much at risk of damaging their vehicles on this road. But anyway, he does say that they're going to continue their inspection and that they will carry out these repairs. But it's just unfortunate, Chair, that the local residents using this road, and this is a road that is in very heavy use because it functions as a distributor route between the village of Killyclogher and the Gorchin Road. So it gets very heavy use, and it's just unfortunate that this road has had to suffer this damage. But hopefully we are at an end to this, and we shall keep a watching brief on how quickly those repairs are being carried out. But I certainly would not agree with Mr. Kearney that there's evidence of minimal damage. He's clearly not looking at the road that I'm looking at. So thank you, Chair.
Thank you, Josephine. Page 9.
Yes. Sorry, Chair, just at the top of page 9, at last month's meeting, I was just asked to seek some legal advice in relation to what was described as the ex officio status of members in relation to Kesh Development Association. So I've obtained that advice, Chair, and the advice is that at the very least there would be a perception of a conflict of interest. So in those circumstances, the advice would be that the affected members would declare an interest and would excuse themselves from the chamber when such matters are being discussed. But obviously it is a matter for the individual members. So just really a proposer and seconder to note the update on that legal advice, Chair.
Barry?
Again, I'll come back to 4.11 on page 8 before.
All right, okay.
Do you want me to do that now, or do you want to exhaust?
No, we'll finish this and then I'll come back to you.
Thank you.
So can I have a proposer, Councillor Roof and Councillor Elliott? All agreed, thank you. And yeah, no problem. Barry, do you want to?
Yep, thank you, Chair. 4.11 there, the roads issue has been spoken about in the course of the evening. I want to come on to the resolution which I proposed at the last meeting. A, writing to Land and Property Services seeking clarification on the availability of rates relief for businesses directly impacted by prolonged roadworks. Some of them in that immediate area are talking about having been impacted for a year now. And the news that the Gorchin Road, is closed for at least 8 weeks is having serious impact on business, a number of businesses. I dropped into a business 2 days ago to speak to the owner of the business, and he was despairing, absolutely despairing about the future and about revenue being seriously down to the tune of thousands. Customers unable to access the business, now just one-way traffic for a significant period of time. So this is a real problem. And then the other aspects of the proposal about writing to the Department for Communities, I presume we don't have a response from the Department for Communities at this time.
No.
And then thirdly, arranges a meeting for the affected businesses with the Economic Development Team. Now, I'm aware that one business received, a phone call, but I still think a round table meeting convened by the council with impacted businesses in that area would be helpful. They're crying out for something. They're crying out for a bit of leadership, and they're crying out for attention. Like, even to note the extent of the losses in the relevant businesses would be a useful thing to do, and forward that to the various departments. And I won't speak about the recent business that suffered the fire. Things will be ongoing there. I'll not come into that territory in the course of this, but this is specifically about businesses who are in danger of going under, specifically because of disruption to their daily business by prolonged roadworks. And it appears that no government department, no government agency is going to respond to their plea for help at this time. So I reiterate the need for a roundtable meeting convened by the council with those businesses to discuss the situation they're in and their future options. Thank you.
Chair, it was just, we'll obviously progress that, and I know efforts are being made around certainly the meeting, Chair. It was just to advise members, I'm not saying that particular area in question, Councillor McElduff, but I think at the recent Stroul community stakeholder meeting, it was referenced that the overall road scheme has now been delayed. It'll be November before completion. So I know that's something that the council has also expressed concern about previously. We will reflect obviously on that, but just for the wider benefit, because I think people, well, certainly we had all been advised it would be concluded much sooner than that.
The business that I visited the other day was there for an hour. There wasn't a single customer over the door, and there's maybe £120,000 worth of product. This is where you cross the door, do business over the counter. It's not an administrative centre or anything like that. It depends on footfall from customers. Thank you.
Okay, thank you. Errol?
Yeah, thanks very much, Chair. Following on from Councillor McElduff and from the Chief Executive, I would be certainly supportive of what Councillor McElduff has said once again there with regard to the roundtable meeting. We did attend the stakeholder group, as the Chief Executive has alluded to there, last week, and we were given the update that it was going to be November 2026 before all this roads project was completed. Now that has jumped from September, then it was October, now it's November 2026. So people just need to be aware of that. The businesses and the residents and everyone else who's travelling in that area need to be aware that it's going to be November 2026 before that is complete. But I'm happy to support the comments, Chair. Thank you.
Okay, thank you. Councillor Green?
Thank you. Yeah, I suppose it's not specifically in relation to this, but it's the speed it takes to get these projects once started, to get them finished, and even to get a project started here. Like we have examples of the A5, the Enniskillen bypass, all the delays and everything. And I was just looking at examples around the world of how quick projects can be done. And one thing that kind of caught my eye was that China built 2,000 mile of railway per year over the last 20 years. So 40,000 mile of railway, 2,000 mile of railway per year. You know, we can hardly get a half a mile of a road upgraded. We can't get a bypass. We can't get the A5. We're just bogged down in bureaucracy and I don't know what gridlock across the whole north in every project that we go to do. You go to Dublin, the Children's Hospital has gone on 10, 15 years. You go to Belfast, I think it's the new maternity hospital, is sitting idle for years upon years because of a brand new building can't be got opened. It is just shocking the state of the thing here, where everything's been run. But I just thought it very interesting, 2,000 mile of railway. Just imagine that up and down Ireland in 1 year, 2,000 mile. Completed, by the way.
Thanks for that. Thank you. Nobody online, so we go to page 9, 10. Page 11. Page 12.
Page 12, Chair.
Yep.
Chair, just on page 12, we have a couple of letters, members, on item 13.1. Firstly, a response from NISRA in relation to the updating of the multiple deprivation measures, basically saying there's no timescale for this work. It's acknowledged it's out of date and there's also no defined resource budget availability for it. And then secondly, in relation to the review of the People in Place review, which impacts specifically on neighbourhood renewal areas, that work has been completed and is with the Minister for Communities, who's giving consideration. There's no detail as yet as to when the findings of that will be published, but it doesn't anticipate any changes within the current financial year for neighbourhood renewal programmes. So just really for noting, Chair.
Just for noting, yeah. Noting. Barry, and who else? Dermot. Thank you. All agreed. Page 14.
Yes, Chair, just on page 14, a response from DFI. This is in relation to the A32 and the desire, I suppose, for both better lighting and safe crossing at the Caffrey building. So confirmation from DFI, while it might be desirable work, it's not an essential, and they have no planned works in this area.
Thanks, Alison. Adam?
Thank you, Chair. And firstly, I'll propose to note the correspondence. I think it's disappointing. The whole point of an active travel scheme is to make it safe and encourage people to be able to travel on foot or by bike where they're going. Yet this is going to the agricultural college and doesn't provide safe travel, because pretty much the vast majority of the population, if they're coming from Enniskillen and heading out that way, they'll have to cross that road. And I highlighted the last meeting, I'll not get into how difficult that is. Again, Chair, it just seems to be nonsense, especially when they're talking about control costs crossings in the letter at other locations. And that's not to diminish the need in those locations. It just seems to lack common sense. And then obviously the knock-on impact that has for parking at the hospital, as mentioned in the last meeting, and the safety issues around that as well. Now the wider active travel scheme mentioned it is really good, and it's good to see the progress on it. What I would like to do, Chair, is I'd like to propose just that we write back and we ask for a kind of a projected timeline on the delivery of that scheme, because it will be, my criticism aside, it will be a really good scheme. And just so we have an idea of what the timelines are for, Chair. Thank you.
No problem. Thank you. John?
Thank you, Chair. And again, I'm slightly disappointed with the reply. Given the circumstances that we had painted, that the vast majority of the students on that site are under 18, those that live on it permanently and during the term time, and the others are travelling in. And given also, while it's not been sexist, it is predominantly young girls, and every other body across every political body is promoting ending violence against women and girls. And it's quite simple. If it's well lit up, it's going to make it a lot safer for them. And I'm totally, noting the correspondence, I think maybe if we were to put that in some letter reflecting that as well, that this is a key point that all departments in Stormont apparently are taking on board. And I know we as a council are actively involved in that. So I can't see how they can't apply that to this particular location.
And do you want to second Adam's proposal letter? Are you happy? Is it added in, Adam? Yeah, thank you. All agreed? Okay, thank you. It's 14, so page 15.
Just into 15. Chair, just the bottom page 14 into 15. I'd maybe just at this point refer members to the briefing documents which we received yesterday from the Western Health and Social Care Trust, which we circulated to members. One did deal with the RQIA report and the concerns from the Trust in relation to misinformation around the report and its interpretation. And the second related to the visioning exercise. And just, Chair, in relation to the visioning exercise, reference is made in it. And I just think it's important, probably from a council perspective, to clarify that it's being undertaken, the visioning is being undertaken in partnership with Fermanagh and Omagh District Council, so using existing community planning structures. So just to clarify, we did have a presentation to not the previous meeting last week, but the meeting before that, of our Strategic Partnership Board. There has also been a briefing to our Integrated Wellbeing Network, and the Integrated Wellbeing Network has provided both some contact details for interested groups and suggested potential venues. I don't think it's accurate to suggest, though, it's a partnership approach in relation to this visioning work. The Council has obviously received briefings, and I imagine will receive further briefings as this work goes on.
Thanks, Alison. Adam?
Thank you, Chair, and thank you to the Chief Executive for that clarification. I think that was important to note there. And I'll propose to note the documents. Chair, I do I was looking at this and looking at the survey, and 80 engagement meetings, an extensive program of preparatory engagement. And this is in effect what they've come up with, 5 questions plus a 6th question for other. That really, like, they are asking basically, how would you feel more how could we make you feel more confident in receiving services in a different way? It's nothing about the services, it's nothing about the vision, it's nothing about any sort of plan. And they've had a year to do this. I'm pretty sure my students in school could come up with a better survey of 5 minutes on ChatGPT. To be honest, Chair, I think it's really poor, and I hope this isn't the direction of travel for this whole vision plan. Now, I do think the whole vision plan is it's a smokescreen for the minister to abandon his duties and abandon his responsibility, because ministers provide vision for their departments. Every department they do. And to be fair, in my opinion, it's not the Trust's job to make the vision, as much as I've criticised that, and I think that it's really poor. Chair, I know we have the motion later. I'll talk more about it then. But it's really poor.
Okay, thank you. And Dermot?
Thanks, Chair. Yeah, similarly, I just want to express that, I would have some concerns as well. One of the lines which strikes me in that letter from the Western Trust is that it says it's an engagement programme and not a public consultation. And that sort of smacks of civil servant speak. And really what I gather from that is that they're not interested in hearing the views of everyone in the public. They're only interested in specific sections or certain people. They're trying to sort of manage responses, I think. And as Councillor Gannon has said, there's 5 questions, leaves a lot to be desired. I think, again, trying to direct the responses, nothing in there about the SWA, nothing about emergency general surgery. So I think they've a track record of missing the mark on these public engagements and consultations. And I fear that we're on the road to another failed attempt here at getting proper views from people. Thanks.
Are you happy to second the noting? Okay, thank you. And Josephine?
Thank you, Chair. Well, I'm aware that there is a motion coming up later in the meeting. However, what I will say is this, is that, we have a new Chief Executive of the Western Trust, and there isn't a member of this council who would wish for anything other than the restoration of full acute services in the South West Acute Hospital, including emergency general surgery. That is something that we aspire to. But I think that we have to recognise that, as a public body, we have to work in conjunction with the Western Trust and with the Department of Health. And yes, I do agree with Councillor Gannon that it is the vision and strategy of the Minister for Health in terms of how health and social care are delivered. But we all know, we have known for many, many years of the challenges that exist currently in the delivery of health and social care throughout Northern Ireland, but especially in the southwest sector of the Western Trust. We are challenged at every opportunity in attracting and retaining the staff that we need. So, I think that public engagement, which is proposed by the Western Trust, is a good thing. It's not a consultation, but it does represent a vehicle for communication. And I think that communication and engagement is always a positive thing, because we as a council have to look at the conditions which exist within our council area as to how we can encourage professionals to come and work and live and support our acute hospital. So whilst the proposals by the Western Trust are not perfect, I don't think that we should dismiss them. And I would like to see us as a council and indeed every member of the general public engage as fully as possible with the Western Trust in trying to find a way forward through what has proved to be a very vexatious issue, Chair. So I just want to make those comments. Thank you.
Thank you. And Eddie?
Thanks, Chair. And yeah, just to echo what's been said so far, you know, the work itself here, the questions that we're going through themselves are actually valid questions about, you know, improving efficiency, using technology where we can. You know, we hosted the health conference about a year ago, and we talked about a lot in detail, and had examples from other parts of the UK where that was being carried out, and particularly in areas similar to ourselves. It was quite rural and it was effective. So that's fine, and I think we can support that side of things if it means that patients get seen in a more timely manner. It doesn't really acknowledge the actual reasoning behind the the overview or the review required in health in Fermanagh and Tyrone. It doesn't mention emergency general surgery. It doesn't mention access to services and acute services in a local area. So, you know, it's addressing something completely different to the actual issue. I'm more than happy to look at this at the Your Voice Matters as an entity and as something that can help in one section of healthcare, but it really does not in any way address the actual issue here. So it's a bit disappointing that it's presented in that way. It should be two separate entities altogether. Thank you.
Okay, thank you. And Alison's just going to come back in now.
Chair, no, thank you. It was just to advise members, as Chair, as you'd mentioned at the outset of the meeting, just due to the sudden death of Dr. Tom Frawley, the health subcommittee meeting was postponed. We are working with the Trust on rescheduling. It is looking like that will be Wednesday, the 29th of July. We will confirm that hopefully with members tomorrow. There is also that afternoon an LDP steering group, so we're just seeing if both can be accommodated. But we will. I know the Trust is keen to engage with members, and the new, as has been referenced, the new Chief Executive would also plan to be at that meeting. So we'll hopefully get that confirmed by the end of this week, Chair.
Barry?
Yep. We ourselves as a council have taken initiatives, of course, you know, to progress our own health situation in this council area. And I know the Chief Executive's invested in exploring this, but are we any closer? And hopefully during the lifetime of the Ireland presidency of the EU to hosting a major conference on health. You know, it all started with Councillor Green's motion, you know, that focus that we are bringing to things. It ended, well, it didn't end, it continued with the ICLRD report. And one of the recommendations there is that there is an international health symposium annually. I think it is, or annually or biannually. And I think we've identified the advantage that Ireland's hosting of the EU presidency. It says here that there will be around 250 conferences, political events and stakeholder engagements. And, you know, we're not waiting on anything to come from the centre of that. We should be imposing ourselves on the EU presidency to have that conference in the next 6 months, I would suggest. So is there any thinking around that? Is that happening?
Yes, Chair. As Councillor McElduff has said, that was one of the recommendations from the ICLRD reports. We are actually currently seeking quotations for both the service and the facilitation of the event to take place within the Ireland's hosting of the presidency, which would therefore happen before the end of this year. So certainly based on work to date, I'd be confident that that will happen. We'd obviously report that back into members. There is a related point, Chair. There were a couple of other actions around advocacy. The council had previously agreed to write, and we did, to the health minister in Dublin, Minister Jennifer Carroll McNeil. So actually, while he was in the position of Chair, Councillor McElduff and I met with senior officials from the department. They provided us with some further information, but did suggest that we would also perhaps wish to engage in sectoral format with the North-South Ministerial Council. So we've also written to the joint secretaries there and are hoping to get a hearing for the, if you like, for the ICLRD research at an appropriate juncture, again, hopefully before the end of the calendar year.
Thanks, Alison. So I think we didn't actually get, with just the noting, then we didn't actually get a proposal and just updates. Okay, so we'll just carry on page 15. 16.
Thank you, Chair. Yeah, we just on the item 13.7, just in relation to the border roads, to advise that we have a few responses here. Firstly, from the Minister, welcoming the motion and noting her own work, particularly around trying to get a budget specifically around rural infrastructure, and also suggesting that we make representations to the North-South Ministerial Council. So we do have a response from the Joint Secretaries. They've advised that it's more at a strategic planning level rather than the specifics on border region roads that they would consider, but are happy to note the work. And then lastly, from the Executive Office, who have confirmed that as it's within the responsibility of the DFI Minister, they're noting the correspondence and are aware that we've made separate representations to the Minister in that regard.
Okay, thank you. Seamus?
Thank you, Chair. And the letter back from the Minister, I took it quite positively. I was glad to see that we have been acknowledged in it and that they would be happy to maybe participate in a conference or whatever. And I suppose the thing what Barry said there previously about the Irish presidency of the EU, again, would this be something that would be a good thing to try and get, because seeing our motion said about the EU as well, would this be an opportune time to try and link that in as well, given that Ireland has the presidency? I don't know whether that could be done, but would that be something the Council might be able to try to follow up, something similar to the previous proposal?
Chair, I think it may have been to our last month, well, a recent meeting of Environmental Services. I know John had brought a report on the motion. I think we could certainly explore it. The difficulty may be in having the research completed in advance of the end of essentially of the year. Now, there would possibly be the opportunity to do, I suppose, what they'd call a plenary session, whereby there'd be presentations and the research could essentially be maybe developed in parallel, but I don't think it would be, we'd have enough time to get the quotations, do the research and do the event within that sort of 4 or 5 months. The slight difference with ICLRD is the research is in place on the health matter, but we could certainly explore the potential for a symposium, if you like, where presentations and research could be done in parallel if members were minded.
Do you need to second it? Can we have somebody to second that, please? Nolene?
She's content to note on the letters as well.
And Seamus, you can content to note the letters and to second Nolene? Yeah, everybody in agreement? Thank you. 17, page 17.
Yes, Chair, just to note item 13.9, since our last meeting, we have had the ad hoc committee meeting in relation to the call-in of the Planning Committee decision, and the unanimous decision of the ad hoc committee was to refer the matter back to the decision maker, which is the Planning Committee. So a report will be brought to the July Planning Committee meeting in relation to the application. So really just for noting at this stage, Chair.
Anne-Marie Donnelly and somebody else?
Councillor Gannon.
Councillor Gannon, thank you. Page 18, 19, 20, 21, 22. Oh.
Chair, this will just be on the vote.
All right, okay. Councillor Mahon?
Yeah, thank you, Chair, for letting me in again. As just as I'd said earlier, I had hit the wrong button in the voting sequence and I was unable to change it then. So I would just like, if possible, to record that I would have been voting against the proposal if possible. Thank you.
Okay, thank you. Oh, do you have to come in there?
No, sorry, Chair, it's just further on that page, page 22. Members, we have a response from DFI Roads in relation to the resurfacing of Main Street, Brookborough. So it's just the response. You'll see that it's essentially, ongoing review, maintenance and patching work within the budget availability.
Okay, thanks, Alison. Oh, propose and second the letter. Adam?
I'll propose the note and just a quick point. Chair, obviously they mentioned about the structural maintenance programme in the letter. I'd be very interested if we could and I propose that we write back to DFI just to ask, can we see a breakdown of the funding allocated through the structural maintenance programme to each council area over the last few years? Because it'd be really interesting to see. I don't know if they'll have it. They might come back and say they don't have it, or maybe we already have it. But I'd be interested to see it. I think we all would. It's something that we all point out frequently enough, the lack of investment in the area, and it'd be interesting to see.
Chair, I think we may have that information, Councillor, and we've dealt with it at the Rural Affairs Subcommittee, but perhaps could I suggest we'll check, and if we don't, we will follow up, so we could get just a second or maybe on that basis.
Colette. All agreed? Yep. Okay, thank you. Page 23 and page 24. So,
to your planning, so Glenn isn't here, so we would.
Oh, the Tommy, right.
The planning committee, registry number 9.
Now, let me just find it here. So we're going to the planning committee held on the 20th of May. And then Skillen and Glenn isn't here, so we're going to go to Tommy, Councillor Tommy Maguire. So, for accuracy, yeah. Have we done that? No, we haven't. So accuracy first, page 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, and page 22. Can I have a proposer, please? Oh, no, I've just come to Councillor McLeod, sorry. Oh, yeah.
Do a second.
Margaret Carley, in the absence of the chair, Glenn Campbell, I'll propose the minutes, Chair.
Okay, thank you. And we need a seconder, please. Errol, thank you. Yeah. Is he there? Yeah. So, yeah. So we'd go through matters arising now on page 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21 and 22.
Planning on the 22nd of May.
And we'll now go to the reconvened planning committee, and is Tommy there yet? For accuracy, page 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. We have it. Oh no, Tommy, just.
Yeah, go
Oh,
on.
yeah, sorry.
Yeah, I'm happy to propose the minutes.
Thank you. I'm not used to
In the
this
absence of
being
Claire.
there. Thank you. And the second, councillor Harold Thompson. Thank you. And when matters arising, page 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. We will now go to environmental services. The chair is Councillor Dermot Brown. We'll go for accuracy first, page 1, 2, 3, 4, 5, 6, 7, 8 and 9. Dermot?
Thanks, Chair. Yeah, happy to propose the minutes.
And can we have somebody to second? Councillor Little, thank you. And matters arising, page 1, page 2, 3, 4, 5, 6, 7, 8 and 9. Barry?
Yep, page 8, Chair. Lehanach Ahacht, Charlie, 813 management. And there was reference there till the recent Woodland Trust findings. And it specified Oma as having the lowest regional 3 cover score. And it said this has implications, negative implications for air quality, flood risk and health outcomes. And then we were advised that, for example, at Green Hill Cemetery, approximately 2,700 native trees have been planted, which is good, which is positive. I was doing a bit of research regarding an initiative that the council officers may be aware of in Derry Strabane Council. It's called the LIFE Project. And for every birth, death and marriage registered within the council area, an oak tree sapling is gifted to symbolise growth, remembrance and new beginnings. It's a real proactive initiative aimed at improving air quality across the Derry Strabane council area. And real good initiative, I think. For example, there's a collective event in the year, a tree planting day. Say, for instance, you didn't have a suitable space, then the council hosts an annual tree planting event where trees can be planted as part of a shared community effort. All necessary tools and equipment will be provided. And it's kind of a celebratory thing in the context of a new birth, and a remembrance thing in the context of a death. That a tree sapling would be provided for every life event registered in the council area. And it seems to be a fantastic initiative. And I would propose that our council explore the viability of introducing a similar initiative in the Fermanagh and Omagh council area. It would be substantive, but it would also be symbolic, addressing the Woodland Trust findings and trying to improve our air quality, reduce our flood risk and improve health outcomes. So that's a proposal I'd like to make, Chair. And, you know, obviously that would lead to a report coming back to the relevant committee or whatever.
Yep.
I wouldn't just bounce it here that we take that action, you know, without due consideration, but proposing that this be explored. Thank you.
Okay, thank you. Roy?
Thank you, Chair. I welcome Councillor McElduff's proposal on that. I think it's a very good initiative. Certainly, I'm not quite sure what the death figures recorded within all the various cemeteries in our district, but I don't think they're terribly big, thankfully. But in the meantime, I think it's a very good initiative, and I would greatly support that.
Are you going to second it then?
And I'll second that, yeah.
Okay, no problem. And all agreed? Okay. So that's the end of that. So now we have the audit panel held on the 8th of June. For accuracy, page 1, 2, 3, 4. Seamus?
Yeah, I'm happy to propose that.
Oh, we're not at the end yet.
Well, that's what was put me late on. Wasn't expecting to be called in.
Sorry. You'll have to come in again then. 5, 6, 7, 8, and 9. Seamus?
I'm refusing to speak now.
Really?
I propose that.
Thank you. And Josephine?
I'll second, Chair. Thank
Lovely,
you.
thank you. And, oh no, Rosemary, you're okay? And matters arising now, page 1, 2, 3, 4, 5, 6, 7, 8, and 9. Thank you. And now we go to Regeneration and Community Committee. Okay, and Councillor Patrick Withers isn't here, so could we have someone else? Wait, yeah, well, somebody else can come in then. Okay, so for accuracy, page 1, 2, 3, 4, 5, and 6. Seamus, do you want to confirm? You got the now? Councillor Barton, do you want to? Okay, thank you. And somebody to second it? You're still not talking, Seamus?
Councillor McElduff, Chair.
Councillor McElduff, thank you. And for matters arising, page 1, 2, 3, 4, 5, and 6. No matters arising there. So policy and resource held on the 10th of June. For accuracy, page 1. Oh, and hold on, let me just see. So, yeah, Councillor Donnelly. 1, 2, 3, 4, 5, 6, 7, 8, and 9. Anne-Marie? Oh, I've got to put you on the line. There you go.
Thanks, Chair. Happy to propose minutes. Thank you.
Thank you. And can I have somebody to second, please? Rory, thank you. And for, oh no, matters arising, page 1, 2, 3, 4, 5, 6, 7, 8, and 9. So that's where we are now. So we're doing correspondence. Yeah.
Okay, Chair, so just into correspondence, the first two items are from DFI, or sorry, related to the same area. The first is from DFI Roads, the second from Forest Service. So Council had previously raised concerns in relation to forestry operations and the impact that was having on the roads in question. So we have the response from the Acting Divisional Roads Manager around the defects, and then also from Forest Service, again reiterating that the restitution works is up to DFI Roads, but they are aware of the forward work programme. So both for noting, Chair.
Thank you. Seamus?
Could I suggest that we write to one of the departments, maybe finance or whoever, and suggest that Forest Service, who is a government body who earns its own money, does contribute to or put some money toward the state of the roads after they draw their timber out of, because it's always the rural roads, especially the ones in the hills, that get racked by Forest Service when they do this, and they just walk away and wash their hands of it. I'm not sure. I suspect that if farmers damage the roads, or that they are expected to put something into repairing them, or big businesses. I might be wrong on that. I probably am, but I think Forest Service that does give money should be asked to contribute to some of the repairs on local roads in the rural areas where they really cut them up. Some of them looks like lanes after they're finishing them, and it's an absolute disgrace that they walk away with the money and put nothing back into the community.
Okay, thank you. Anthony?
Thanks, Chair. Yeah, I agree with Seamus there and second the proposal.
Okay. John?
Yeah, I was going to come in second, Seamus. I totally agree. I mean, the Forestry Service is one of the few government departments that actually is a business. It's harvesting trees, and it's not giving them away to anybody. They take money for them, and the fact that they don't give anything back. And I mean, we've known as a council, whenever they even pass property over, they're passing over their responsibility and their statutory requirements to allow access to the public to those sites. So they're writing tight with the purse strings, and I think maybe the finance minister should be having a look at what they actually do with their money.
Okay, thank you. So we have a proposal and it's seconded. Everybody in agreement? Yep. Okay.
Thanks, Chair. The next item is just from Northern Ireland Water regarding the water treatment capacity sheet. So confirming that date is not yet available, is expected to be ready in August and will be shared with us. So again, just for noting, please.
And Councillor Anne-Marie Donnelly and Eddie Ruth, all agreed. Thank you.
Thank you, Chair. The next item is from COT. And members, you'll be aware that we do have an informal meeting scheduled with COT on the 21st of July at 4 o'clock. We had asked for a more detailed breakdown of their funding interventions specific to the council district. So that's appended to the letter, and I imagine will be something that will also be covered in the course of the informal meeting.
Yep, Barry?
Yep, I'd like to propose the noting of that correspondence. I'm glad to get the reminder of the engagement we're going to have with COT, and that correspondence will help our approach to that meeting. Thank you.
Thank you. And can we have somebody to second, please? Thomas O'Reilly, thank you.
Thank you, Chair. Chair, the next item is from the Northern Ireland office. And I know as members will be aware, but this is the first formal communication we've received in relation to the local government election next year, which is, of course, a dual election. So the letter really sets out some of the legislative amendments which are required, and the NIO are making the appropriate arrangements for those. I suppose for our purposes, really, well, the early part of the second page of the letter sets out the timescale. So the local council count will not commence until Monday the 10th of May. That will have a knock-on effect in terms of the overall timescale. And it also, because we are required to convene our first annual meeting within a specified number of days, so that might also change. There is another anomaly, Chair, that isn't addressed in this letter, but we understand the Northern Ireland office are looking at, and that's relating to dual candidates. So people who stand both as an assembly candidate and a council candidate, if they are elected in the assembly, are debarred from becoming a councillor. But their votes would then obviously be counted, and then there's a co-option matter for parties. So that timetable also has to be considered, and I understand is undergoing consideration at the moment. So any further communication we will bring to you, but at this stage, just for noting.
Dermot?
Thanks, Chair. There is a bit of confusion around some aspects of this, particularly in relation to how people will be expected to put both their ballot papers into one box. And just, has that ever happened before? Maybe we get some clarity on that, because that will be quite confusing, I think, especially when it comes to actually opening the boxes then at the count centre, because all the ballot papers will be dumped on the one page, or on the one area. What does that mean then for verification of ballots and counting of ballots? And, you know, do the ballot papers go to, the council ballot papers go to the count centre and then move to a different count centre? Is that, you know, there's a lot of things there that are not clear, so further clarity would be welcomed.
So, Chair, I'll provide just the clarity as I have at the moment, but I do think it's something, and I understand maybe the electoral office are going to engage with parties. So, to the best of my, well, the last dual election I think was in 2011, but to the best of my knowledge, this is the first time that there's ever been a single ballot box. So there was always a box for council elections and a box for assembly. So as I understand it, the process is going to be the single ballot box, each single ballot box will be brought to the count centre, which in our case will be Meadowbank Arena in Magherafelt. There will then be a dual verification. So the votes will all be, as Councillor Brown has indicated, poured out, and there will be simultaneously a verification for the Assembly and for the Council. The Council votes are then going to be regathered and put back in a ballot box and stored securely in Magherafelt, and are then going to be transferred to our count centre in Omagh, but not before the Sunday evening. And then on the Monday when we start the count, the number that is agreed at the verification on the Friday morning is the number. So we will proceed straight. There won't be a further verification. We'll proceed straight to sorting at that point. So the process of the dual verification becomes very important, because if there's any inaccuracies at all, that really does present difficulties, I think, anyway, for the council count on the Monday morning. But I don't think it has been done in this way before. And certainly from an officer perspective, we have endeavoured to highlight some of the concerns and risks. And I imagine parties will choose to do that as well.
Thanks, Alison. Adam?
Thank you, Chair. And I think actually the last occasion, this was 2014, European and local councils. I just remember distinctly because it's my first ever time voting. And there was two separate ballot boxes on that occasion, and that was, like, I was my first ever time going into a ballot box. It was quite simple. I don't think, I don't think one ballot box is the way to go. Really, I share the concerns that Councillor Brown has raised there. They just seem like a recipe for disaster. And what happens if one turns up in a pile and it's went through to the assembly count, then you have to find it and put it back and find the right box and all. It just seems like a bit of a disaster waiting to happen. I don't know if Councillor Brown made a proposal there to relay those concerns. If he did, I'd like to second that, because I think two ballot boxes going to separate places is much more simple. If I can go into my first ever vote and work it out, I'm sure, and the polling station staff are very good. I'm sure they'll be able to direct people correctly, Chair.
Okay, thank you. Seamus?
Yeah. My train of thought kind of slipped there a second. When you say they go back into the ballot boxes, then do they go back into the ballot box that they came out of, as in each ward? So we'll say the Brupra ones go back into the Brupra box and it's sealed again, or do they go into a collective? I'm not sure. I have a couple of questions, but can you clarify that, Alison?
That detail hasn't been provided to us, Chair. My assumption would be they should go back into the ballot boxes from which they came and then are resealed, but that hasn't been clarified to us at this stage.
Yeah, I think that should be asked as well. And when you say the sorting will start immediately, is that counting?
No. So it will be so basically, let's just take a round number of 1,000 votes, for example. So the verification will take place in Meadowbank and the ballot box will come back to us and say there's 1,000 votes. So we will then proceed to start allocating those votes across. So the sorting process, there won't be a further count. So there won't be a second verification, which also I think presents difficulties, because if you have an error, and I'm very aware there's many more experts in this than I am in the room, but if you have an error in the Meadowbank, that error will then carry all the way through, but the outworkings of it are going to come in the council election.
And a lot of parties will tally the votes. How will that operate under this system? How would a party tally the votes if there are both assembly and council coming out together, or would you still be able to do that when they come back to OMA?
Well, now again, I'm working, that hasn't been clear. My assumption from what we have been advised, Chair, is that the expectation is that the tallying will be done at the assembly count, because that's where all the votes will be put out together. And essentially, I think what that will mean is that you'll have double tally teams, you'll sort of have assembly teams and council teams.
I think that's just going to be a recipe for disaster. I think whoever the elected officer is, instead of making things simpler, he must lie in bed at night thinking of how to make it more complicated.
Thanks, Seamus. John?
Thank you. I was just going to come in on something similar to Seamus just ending off with there. Again, my question was around the tallying, and that's been clarified. But as you will know, Chief Executive, the last time there was a count at the Meadowbank, it was pure chaos. There was insufficient parking. There was numerous problems with that location, and now they're going to double the amount of people that are going to be there. In my opinion, because you're going to require double the amount of people to do to carry out what was carried out the last time. So I really don't think this person has looked at that site and thought about this at all. And I really don't know where they're coming from. And I agree with Seamus.
Okay, thanks, John. Eddie?
Thanks, Chair. Yeah, another scenario on that front really is, once they've been separated and then the council votes go into the ballot box and get sealed up, well, you can guarantee there's still going to be the occasional council ballot hidden amongst some of the assembly votes. Are they going to be discarded? Are they going to be added to an already resealed ballot box? So it just doesn't make any sense to, I can't really fathom the reasoning behind it. As has been said, I think 2 ballot boxes probably make a lot more sense. We've got very skilled and people who've been doing elections for a long time in these voting stations that can assist voters. I think we need to probably write to suggest we're not overly sure about this as a process, and that there's just too many areas in where this can go wrong.
Okay, thank you. Rosemary?
Thank you. I totally agree with everything that has been said so far. But I'm just thinking of the logistics. Councillor McLaughlin referred to it. If you've all the council candidates and all the assembly candidates and their teams or whatever, it's not going to be possible even to get near to even look at or try to verify, try to do tallies or anything like that with the numbers that are going to be around. Another thing too, I want to ask if the ballot box, we'll use an example, there's 1,000 votes in a ballot box, or that's what we're told in Meadowbank. They arrive into Omagh and there's only 996. What's happening, or how can you verify? Where will those 4 be found?
They won't be counting them in Omagh.
Pardon?
They won't be counting them
Well,
in Omagh.
wherever they're counted. Councillor, I didn't know.
They are going to do a recount. Okay. Oh.
Yeah, and the other thing, whose great mind was it what was the thinking behind one ballot box?
So, Chair, just in relation to the one ballot box, my understanding that came from, now we can clarify, but I think that was the Electoral Office's proposal because they felt that would be more straightforward for voters. But obviously we have a proposal and we can go back and seek clarity on that. Just to, and recognising we haven't had any detailed briefing on this, this is the most formal correspondence we've received. But as I understand it, and just to take the round number of the 1,000 votes, we will be told, we are invited to participate or to watch the council verification, but once the number is agreed in the Meadowbank, so let's say wherever Omagh DEA has 1,000 votes, that will be the basis on which we work. If then we come and do our sort in Omagh and discover that we've only got 940, we will have to advise that there is a difference of 60 votes. But we will not have been responsible for the count or the other process around that. I assume what will happen, and if you were doing it through a normal, we would always do a double count. And then if you got the same number twice, that would be the number with which you go. So if we were getting 940, irrespective of the number coming from the Assembly, we would be saying we've 940. However, I fully anticipate that any candidate would say 60 votes are now missing. And we wouldn't be able to track those.
John?
Thanks, Chair. My biggest concern would be the fact that every counting agent is going to the Meadowbank. It was a nightmare just when it was Assembly election. Some counters didn't get in until the the verification process had already started. That would be my biggest concern. Some of the other concerns, we actually have dealt with it in 2011. I for my sins, was an election agent in 2011 council, and the verification was in Omagh that day for the Assembly and the council. Then the Fermanagh District Council ballots were put back into ballot boxes, and they were transferred for Monday morning to the Lakeland Forum. It's not, as long as you make sure the verification is being done right. The only slight difference is it was 2 separate ballot boxes, but there's pros and cons to 1 ballot box and 2 ballot box, because what was happening in 2011 was you went and voted, you rolled up your 2 ballot papers and you just put them into 1 ballot box. So basically then when the verification was going on in Omagh, you were finding Assembly ballot papers in council ballot boxes, and you were also finding vice versa, and they were being opened at separate tables at separate times. So then the votes were down sometimes, but then we're finding them an hour later in another ballot box. So actually for a voter, just wrapping the 2 of them up and putting them into the 1 box probably isn't the worst idea, as long as the verification process is done more diligently. You only need bigger tables, because at the minute there's four verificators at a table, but they're going to have double the amount of things. You're going to have more room for the counting agents, things like that. They'll all have to be discussed and thingied out. But the biggest concern would be the Meadowbank will be a nightmare. And it's not even double the amount of people going to it, because you have far more council candidates and counters. I would be asking for them to seriously reconsider that and bringing them back to council areas and having them in Omagh and, in Mid-Ulster and thingy, because I just don't see how they can do that when they couldn't do it right for the Assembly. That's what my opinion is.
Okay, thank you. Seamus?
Yeah, thanks for letting me in again. Just occurred to me there when we were talking about if there was 40 or 60 votes short. What would happen if there was, when we counted them, there was 40 extra votes in? Would that not really be suspicious? And looking, you know, how would that be dealt with?
Okay. Well, I'm tempted to say I'm sure that won't arise in our East anyway, Councillor, but genuinely, I don't think these scenarios have been thought through. My understanding is, and once the process essentially concludes in terms of the verification in Meadowbank, that is the number. I think it highly likely that there will be differences once we get back to the individual council centres. We have not received any guidance from the Electoral Office as to what would happen in those scenarios, either under if we're below or over. But I think, and the point was made by one of the other councillors, I think it's highly likely that we will find assembly ballots in the middle of council votes. And at that stage, the assembly will have already declared. So I think the complications of this haven't been thought through. If we were just talking about a normal council scenario, because you are running all of, essentially 3 or 4 counts at any time, there is the opportunity for those, if there are discrepancies, to be picked up very quickly and resolved quickly, because of both the dual sites and the fact that one count formally will have concluded with the election of people. I think it becomes much, much more complicated. But we haven't received any advice on it. But we can include that within the letter back, certainly.
Thomas?
Yes. Can I just ask for confirmation that my understanding is that the 2 ballot papers will be of different colours, so that should make life an awful lot simpler to work out the MLA and the council vote. But I suppose I come back to John's point, and the last experience of Magherafelt was less than desirable right from the off, right from trying to get in, get parked. Security was a nightmare, took so long to get through. Then the actual facilities inside the count centre on all aspects were less than perfect. The Wi-Fi was so bad, all of the various services there, and that was just with a smaller amount of people. So certainly I think there is a strong argument for the separate centres as opposed to the one, or certainly they need to make and give us some guarantee that there is going to be massive changes to all aspects of the journey through that county.
Thanks, Thomas. Adam, I'll give you a few seconds.
To be very quick, just to highlight that if it's all done, all counted, and then you do have a discrepancy at council level with the number of votes being smaller, the margins being smaller, if there is a discrepancy and subject to legal challenge, maybe we should raise that as well, that something like that could potentially happen with this arrangement. And just to echo the very, I would go as far as to say, hellish experience of Meadowbank. It was dreadful conditions. I think everyone's been very generous so far describing it. But I'll leave that there, Chair. Thank you.
Thank you. And Councillor Anne-Marie Donnelly.
Just a quick point, Chair. A lot of it's been covered, but it's suggesting that in our communication to the Electoral Office that we should ask, is there any way of having a simultaneous count? And that would account for any kind of eventualities if there's a MLA votes in council and with the council votes and vice versa, that it to be done simultaneously. There could be verification then between the chief executive and whoever's managing the Magherafelt side.
Okay, that's lovely. Thank you. So we've got all those points, and we will get working on that. Have we got other correspondence?
Yes, sorry. Thank you, Chair. Our next item of correspondence is then 2 items, firstly from the Department for Communities, secondly from the Northern Ireland Office. This was in relation to the fuel support scheme and the energy costs. So DFC are noting our disappointment in terms of the delays, advising some time is required to set up a database, but it should be up and running before the winter. And then secondly, from the Northern Ireland Office, again, noting our disappointment, Chair, but advising that they chose in this funding allocation to apply not the Barnett formula, but rather the proportionate funding for the level of heating oil across the nations. And you'll be aware from previous correspondence that Northern Ireland would have one of the highest levels of home heating oil heated homes. So just for noting.
Okay, thank you, Alison. Dermot?
Thanks, Chair. Yeah, really disappointing response from the British government there. The level of support that they've provided has been dismal, or, you know, it's really, really not near what's needed. 17 million, like, wouldn't touch the size of anything. Just to be clear, you know, we asked for the government there to consider a reduction in fuel duty and to scrap fuel duty increases, and then to reduce or remove the VAT on home heating oil. And they've ruled out all of those proposals, basically saying, you know, you've given you 17 million, you're lucky you've got anything at all, now go and do with it what you want. Like, you know, it's the British government there that have, you know, facilitated these wars in the Middle East, and, you know, selling weapons and a 5 billion package to weapons of war, but they won't even provide the money for people to stay warm in their homes this winter. It's absolutely shocking. Thanks, Chair.
Thank you. And Seamus?
Yeah, I'm not sure whether it has been asked or whether they've said what the admin costs of this scheme is going to be, because I think it looks as if it's going to be a nightmare to administer. I remember some of these schemes over COVID, and they were shocking. There was some people never got paid for them, even yet didn't get their money. So I can see this happening again, and I can see it being a nightmare. I think a lot of these government departments has lost the run of themselves as an admin. I'll give you an example. I sent a Freedom of Information request into DAERA to ask how much more it was costing to administer the Department of Agriculture, the new schemes they've brought out 8 schemes to replace one scheme. And in the last year, 2025-26, it's an extra £2 million in admin to administer these schemes. It's just crazy. We were promised on the Brexit to be less red tape, less bureaucracy, but as we see in this and in DAERA and a lot of other departments, bureaucracy on top of bureaucracy, red tape on top of red tape, and it's not getting any better. And any farmer that thought that there was going to be less red tape, God help their little wit, because when bureaucrats get involved in these things, you're going to have bureaucracy.
Dermot and Seamus, can I ask if you're in and a second? Thank you.
Thank you, Chair. Chair, the next item is a response. Now, we had written this was in November of last year, but this is a response from the Foreign, Commonwealth and Development Office. It related to the Council's concerns following Minister Given's visit to Israel. So the guidance that's provided within the letter is really around the formal engagement with the Knesset and the Palestinian Authority. And it's noted that the Foreign Office does not recommend that UK government ministers would visit settlements. There is still, we did have the response from the head of the Civil Service, Chair. I think we do have one further letter maybe to come back on this, so we'll report that when received.
Thanks, Alison. Dermot?
Thanks, Chair. Yeah, it's unbelievable that we're only getting a response to that letter now. You know, that was sent last year, November, and they're only sending a response now. You know, it's hard to believe. They must have real difficulty getting responses out. Just the letter confirms there what we already knew, was that Paul Given shouldn't have went to an illegal Israeli settlement when his wee trip to Israel. You know, he was given cover to the genocide over there. So, yep. But Paul Given, I'm sure he doesn't really listen to that. So, happy to know, Chair.
Thank you. Adam?
I'll second the noting, and I completely agree with Dermot's points there. Just to say that the letter very clearly says that such a visit, as such as Paul Given did, undermines peace prospects, and that directly implies that Paul Given in his visit was actively undermining attempts to peace and a two-state solution, which simply not good enough. But I'll leave it there, Chair.
Okay, thank you. Yep.
Thank you, Chair. Chair, the next item is from Fermanagh GAA, and this is in relation to the proposed development of a community hub at Ashwoods. So the letter sets out the vision for the Ashwoods proposal, and within the letter, Chair, reference is made to, or requesting, the opportunity to work as a strategic partner with the council regarding the development of the facility. Reference is made to our grant scheme, specifically the Strategic Capital Grant Scheme, I believe. However, it's noted or suggested in the letter that the funding scale would be in excess of that. So really the request within the letter is to work with the council collaboratively on developing a robust business case around the proposal. And if members were minded, Chair, that we would work on that basis, obviously we would be looking at the council, the wider community wellbeing initiatives and the potential council benefit that would derive. I would anticipate, Chair, that members would at least wish us to explore this in the first instance and obviously to report back to you.
Thanks, Alison. Seamus?
It's a great proposal. I'm delighted to see it down here in black and white, and I would be happy to propose that we do explore that.
Thank you. Anthony?
Yeah, thanks, Chair. Yeah, I'd be happy to second that proposal. It was a great event up in Ardone that evening. I was up at it, and some very impressive presentations was made that night, and I'm more than glad to second it. Thank you.
Thank you. All agreed? Okay.
Thank you, Chair. The next item is a response from the Economy Minister. Chair, members will recall we had invited the Economy Minister to meet with our Rural Affairs Subcommittee, and due to diary clashes, it wasn't possible to identify a mutually suitable date. So really this is, the Minister acknowledges that members were, I suppose, annoyed about that, and the response to the letter then sets out firstly her unavailability on the day in question, and then there is the written response to each of the queries that the council had submitted at that time. So really just for information at this stage, Chair, and for noting.
Seamus?
It's good to get that letter back from the Minister. I welcome it. I would suggest that we do still ask the Minister to come down at a later stage to meet the Rural Affairs Subcommittee. Also, the questions that was asked, there was questions asked of a number of the ministries, even ministers that came down, those questions. Can Alison remind me, for a while from we've had a Rural Affairs Subcommittee meeting, and it's something I think we need to start to strengthen up again and have them on a more regular basis. But has all the departments come back with the answers of the questions that was given to them that they were all supposed to respond to?
Chair, we can do a more comprehensive report. We didn't have a quorum for our last Rural Affairs Subcommittee meeting, which we did convene, but we were unable to proceed. And so we will obviously proceed to the next date. To the best of my knowledge, most, but not all, have. So we certainly know of responses from, I think, from health, from roads, possibly not from communities, but what we'll do, Chair, is maybe pull that information together. The other thing that we did do was the briefing to some of the committees. You'll remember we had also written to seek the opportunity for the Rural Affairs Committee to meet with the committees. Certainly a number of those responses are outstanding. They did take an initial brief and then they said they would consider it and come back to us, and most have not come back. So we can do a follow-up on that as well if members wish. And we'll obviously get the next date confirmed.
Can you note that? Yeah. Can we have somebody to second it, please? Councillor John Bailey. Sorry.
Thank you, Chair.
Next one.
Yeah, so Chair, just then in our other correspondence folder, we had 4 items. We have dealt with 3. Just the only one that's not dealt with, just proposing for information, it's from Mills Selig, I hope I'm pronouncing that correctly, which is the legal firm acting for Dalradian. So the council, as you'll be aware from previous briefings, has been named as an interested party in relation to a legal action being brought forward by an individual who's named in the correspondence. So we're merely just bringing that to obviously Dalradian are saying they will defend the challenge robustly, and we're just bringing that to you for information, Chair.
Yeah, so that's just for noting. If I can have somebody to note, please, and seconder. Bernard and Thomas O'Reilly, thank you. So we
Correspondence concluded. Yeah, no,
that's done.
Item number 20. So, Chair, just the next item, or item number 22, is a request, please, for council powers to consider the draft response to the Donegal County Council 10T Priority Route Improvement Project. Again, the request is because of the deadline for submission, and that's on your papers for tomorrow evening. So just a proposer and seconder, please, to delegate powers.
Anne-Marie and Rory Little, thank you.
She's happy enough. That's fine.
Yeah.
Number 22.
Okay, so we'll 22, so 22, 23.
So 23, apologies. So yeah, first motion.
So we're going to have our first motion now then, and that is being proposed by Councillor Adam Gannon and seconded by Councillor Bernard McGrath. Adam, you've got 5 minutes and Bernard's got 3. Thank you. Go ahead. Oh, sorry.
Thank you, Chair. I want to start by first saying that this council and the councillors within it have been the strongest elected body and a group of elected representatives on the topic of emergency general surgery. And I think it's important to commend the work of Save Our Acute Services yet again. Another example of this was a well-attended meeting last night. Some of the other councillors in the room were at the meeting, and it's a sign that even after 3 years and 7 months, the work continues for them and they're going strong. The RQIA report, though, Chair, was very clear. The service is not safe. 100% of hospital staff and NIAS staff who deliver the service surveyed in that report said they felt that the service was not safe. And the only people in that report that said they felt it was safe was management. Now, who do we believe? The management in offices who made the decision to remove emergency general surgery, or the people actually delivering the service day in, day out? I know who I believe when it comes to that. And as said, it's been 3 years and 7 months. There is no medical reason why the service couldn't be here in Enniskillen and in the Southwest Hospital. It is a political decision at this stage that emergency general surgery has not been restored to the Southwest. And as the motion states, Chair, it is simply a matter of political will to bring the service back. Now, it wouldn't be instant. It would take time to establish all the clinical interdependencies, which are required now. But the work could start now. We don't expect it to happen overnight, and it may take many years for those to be properly established, months and years, but it could start now. And the executive could bring this service back, in particular the Health Minister. And this council has previously asked ministers from all the parties in the executive to call this in, as they have the power to do, and none took up that opportunity. None cared enough to do this, even to discuss it, not even to take action, just to discuss it, let alone make a decision on it. And as said, the Health Minister in particular, as well as the executive, have real power here. They cannot be let, and in particular the Health Minister, I do stress, cannot be let abdicate their duties to people here. The time to act was over 3 years and 7 months ago. But Mike Nesbitt can act now, and he should. He has the power, he can. And he can't be allowed to kick this issue into touch, run down the clock to the next election, a bit like a team in the World Cup in a tight game, running down the final few minutes. He can't be let right off into his retirement sunset. To do such a thing would be a sad statement of what he thinks of the people of Fermanagh and Tyrone and what he cares about their safety. It would be disgraceful that action is not taken, because he has said no action will be taken until after March 2027 when the visioning is done. And guess what? Nothing will be done, because, as we've seen, we head into an election. He can take action, Chair, and he must take action, Chair, and he needs to intervene now. And I'll propose the motion.
Thank you. Is it working? There it is. There you go. Oh, wrong one. Bernard?
Thank you, Chair. The removal of emergency general surgery from South West Acute Hospital has been detrimental to care of patients in Fermanagh and Omagh. The Trust say that there has been no harm to any patients, but the RQAA report has shown that those delivering the service believe that patients have had a negative and worse outcomes. Staff say it's not safe, so it isn't safe for anyone. NIAS have said that it is common that there are no ambulances covering Fermanagh at times due to the need to transfer patients under the Trust's pathways. This isn't just impacting general surgery patients, but it is endangering everyone who is in need of an ambulance, as the ambulances have been directed to Altnagalvin. The Minister for Health recently said his priority for the health service is patient safety. If that is the case, then he should intervene and begin the process to re-establish emergency general surgery now. If he does not, then it is clear that when it comes to patient safety, he doesn't care about the people in Fermanagh and Tyrone. And I will second Councillor Gannon's motion. Thank you.
Thank you. Dermot?
Thanks, Chair. I want to start off by thanking the councillors for bringing forward this motion on the emergency general surgery. And again, just to agree that last night's meeting was really, really good to see, and there was a great attendance. And hopefully that energy will be sustained. This council has consistently supported calls to restore emergency general surgery ever since the day that it was taken away, and I welcome the opportunity for this council to reaffirm its very strong stance on this issue. It has been 3 years and 8 months since the collapse of EGS, and we still do not have a permanent resolution. As we know, patients who require emergency surgery have to travel for up to 2 hours to Altnagalvin and Derry. And unfortunately for some of these people, that has resulted in a double ED wait, which is a very, very stressful situation for them and their family. And while the Western Trust initially described this change as temporary, it has turned out to be anything but. The report last year released from RQIA revealed serious flaws in the pathways for patients and made a series of recommendations for the Western Trust to implement, many of which have not been implemented. More recently, the RQA carried out an inspection at the SWA and identified serious concerns. Although the report highlights progress in some areas, it identifies significant concerns about communication, governance, staffing pressures, and the monitoring of patient outcomes. The RQA report has highlighted the need for better information on outcomes across the entire patient pathway. Until that work is completed, important questions remain unanswered about the overall impact of the temporary arrangements. What we need here is a permanent solution. The Western Trust announced over a year ago that they would produce a vision plan for the SWA, but although they're talking about an engagement process, I have not yet seen that vision plan. So any vision plan must include steps to return turn the SWA into a fully cross-border hospital, fully accessible by patients in Cavan, Monaghan, Donegal and Leitrim, as we were promised when the SWA was built. The ball now rests in Mike Nesbitt's court. He must ensure that adequate resources, staff and infrastructure are in place to deliver a sustainable, long-term solution for emergency general surgery in Fermanagh and West Tyrone, and there must now be a clear pathway towards the return of emergency general surgery, delivering safe, high-quality care while ensuring that people in Fermanagh and West Tyrone have fair and equitable access to hospital services that they need. Thanks, Chair.
Thank you. Eddie?
Thank you, Chair, and thank you to the councillors for bringing this motion forward. The motion is correct when it says that this is a matter of political will. There's plenty of examples of similarly rural hospitals across the UK that service similar populations to ourselves. In what are called unavoidably small hospitals, they provide emergency general surgery in these rural locations, often in geographical locations that are closer to other hospitals than ourselves. A good example is Barnstable Hospital, which is about an hour and 10 minutes from Exeter, about an hour and 45 from Plymouth, on very good roads with dual carriageway. And they are deemed unavoidably small, despite being far closer to a major hospital than ourselves. Now, I've said this many times before in this chamber and in public meetings, if we were based anywhere else in the UK, under the same circumstances, we would have emergency general surgery today, and we would have never been removed in the first place. This is a decision for the Health Minister and the Health Minister alone. Now, the Western Trust have confirmed in the past that when asked to provide a service by the Department of Health, they would be duty bound to do so long as funding is in place. It's long overdue that the Health Minister accepts this, that makes a decision to fund emergency general surgery back in the South West Acute Hospital. Alliance will be supporting this motion. Thank you.
Thank you. Aaron?
Thank you, Chair, and thank you to the councillors who brought forward this motion tonight. The restoration of emergency general surgery at SWA is not simply a local issue, but a regional issue of healthcare equality. For many people across the district, SWA is not one hospital among many options, but the only acute hospital that can be reached within a reasonable time frame. Long travel distances, poor road infrastructure and limited alternatives mean that decisions taken here have a disproportionate impact on our residents. However, we must also be honest about how we arrived at this position. The temporary removal of emergency general surgery in December 2022 did not happen in isolation. The review of general surgery published earlier that year established new regional standards. SWA did not meet those standards, and that had consequences for recruitment and service sustainability. While the Western Trust has now indicated that it has a full complement of surgeons, it is important to note that not all surgeons will necessarily be trained to deliver emergency general surgery. That is why any future pathway must involve engagement with the Royal College of Surgeons to ensure that correct workforce and training requirements are in place from the outset. The recent RQIA findings also raise important questions. Concerns remain regarding patient transfers and ambulance capacity. The report references the fact that no newly commissioned ambulance service has been put in place to cope with the additional journeys that were expected when these pathways changed. Furthermore, the RQIA report worryingly states that staff morale and concerns on patient safety have been continually raised. Worryingly, they feel that those concerns have not been acted upon or listened to. If the department has accepted the RQIA recommendations, then the public deserves to know what progress has been made and how those recommendations are informing future decisions. I also share concerns about the lack of clarity from the Department of Health. Communities have been left in limbo. We still don't know how decisions on emergency general surgery fit alongside wider hospital reconfiguration plans, nor do we know which decision will come first. For a minister who rightly speaks about tackling health inequalities, there's a growing perception that another health inequality is being created here in the West. Finally, I want to acknowledge the work of SOAS and all those who have campaigned tirelessly on this issue. We now need that same determination from the Minister and his department. Many feel that waiting until March 2027 for the Trust Vision Plan is the equivalent of a political football being kicked down the road, with Purda and the election next year presenting an opportunity for the Minister to walk away from his responsibility on this. The people of this district deserve clarity, certainty and a sustainable future for emergency surgery at SWA, and I'm therefore pleased to support this motion. Thank you.
Thank you. And Victor, and then I'll come to you, Josephine.
Thank you, Chair. The SWA and the restoration of emergency general surgery rightly continues to demand this Council's attention. It's exactly a year on from the Trust's attempt of a flawed consultation last July and almost a year from the Minister's subsequent very important intervention. We all know what was asked of the Trust at the time, and whilst I do welcome now the formal launch of a public engagement programme on a vision plan, progress has been slow. But ultimately, it's most important that this process is carried out correctly rather than rushed. There has been too many mistakes made in the past, and so it is now critically important that local people have their say. I also want to say that I'm very much welcome the engagement the Trust has been having locally with key stakeholders. The engagement is better now than what it once was, but that's the very least we should expect. But this next phase of engagement must be genuine and meaningful. People rightly expect their views to influence their final vision, not simply be acknowledged after key decisions have effectively already been made. My party has constantly argued for safe and suitable local services, including the restoration of emergency general surgery at the SWA, where it is possible to do so. Once the vision work is completed and the final plan is presented, I hope the Trust will be in a stronger and more informed position to determine and set out the next steps. Part of that will hopefully be the consideration moving forward with a new business case for the reinstatement of the service. It is also important to remember the many good things happening at the hospital at the minute. It has never been busier in terms of a number of surgeries happening each week, increased endoscopy sessions and multiple new consultants and specialities such as gynae and gastro. But I fully accept the current situation is far from acceptable. The latest RQIA report, whilst identifying some improvements, also identified continuing concerns around lengthy patient transfers, ambulance availability, pressures on emergency departments, staff relationships, governance arrangements, and the need for better monitoring of patient outcomes across the entire pathway, not just those patients admitted to Acknagelvin. The hugely important comments of SWA staff simply can't be ignored by the Trust. That's why the Trust not only need to take forward the vision work, but also now once and for all move at pace to fix the ongoing problems with the pathways. There's simply no excuse for them. Our party will be supporting the motion.
Okay, and well timed, Victor.
Good, was it?
Went 5 seconds over, but you'll be all right. Josephine?
Thank you, Chair, and I would like to thank Councillors Gannon and McGrath for bringing forward this motion, which I will be supporting. From the very outset, Fermanagh and Omagh District Council strongly supported the restoration of emergency general surgery in the South West Acute Hospital. The South West Acute Hospital is vital for the provision of health services to our local community, not just in Fermanagh, but also in Omagh. I think that there have been very many challenges faced by the Trust, and I do think that we have to acknowledge those challenges. I think that the new Chief Executive is determined to go forward with a spirit of openness and transparency and engagement. And I think that her vision for engagement is one that we should take advantage of. It is not easy to provide any acute service, and our frontline staff, whether it be in Acknagelvin or in the SWA, or indeed any other acute hospital in Northern Ireland, go to work facing enormous pressures. Now, the Trust clearly, referring to the document that we have received, the Trust would dispute claims that the current service is unsafe, and they highlight very significant improvement in patient outcomes and the high rate of patient transfer direct to inpatient surgical beds in Altnagelvin. And I think these are things that must be acknowledged and welcomed, because we as a public body cannot achieve anything unless we work in a cooperative fashion with the Trust and with the Department of Health. Clearly, staff are under pressure. Staff are under pressure everywhere. We must support our frontline staff. Clearly, our patients and our constituents are concerned about the level of care, and it is disgraceful that no measures have been put in place to bolster the ambulance services between the SWA and Altnagelvin. That must change. If the Minister can expedite any of those processes, then it does behove us as a public body to communicate that to him and to insist that he does take action for the remainder of his mandate, because the lives of our constituents are really dependent on it. So my message is, yes, I support the reiteration of this council's support for the restoration of emergency general surgery, but I would say quite categorically that we must cooperate and communicate fully with the Department of Health, the Western Trust, the Royal Colleges, and any other body that has an input into this vexatious
Okay,
issue.
Josephine, that's over 3 minutes. Is that okay?
Thank you, Chair.
Thank you. So yeah. Adam, do you want to come back in?
Yes, Chair, thank you. Just to pick up on a few points that have been said, firstly to thank all the councillors for their support of this motion. I think Councillor Elliott hit a point very correctly there, that this is an inequality, and as Councillor Roof said, this wouldn't happen anywhere else. It only happens here. Other places have it, and we are being treated terribly here. And whether it's failed promises as highlighted with lack of building capacity with NIAS, which many would have said was never going to happen, or this vision plan that has been mentioned. I made my thoughts clear on it earlier. I'll go further and say there is already a vision plan. It's a vision plan this council have endorsed, the Save Our Acute Services roadmap that every one of us has supported here in this chamber. It is the vision plan. And to point out, we had visioning before and called Pathfinder, which was a failed process, yet this process appears to be even worse than that. I am concerned though by one point by the Ulster Unionist was not to rush on this. 3 years, 7 months. Not to rush. Nothing has been done. The Minister didn't make a very important intervention, has been said. He made a very meaningless intervention where he completely abdicated his duties and responsibilities as a minister to provide a vision. That's his job. That's any minister's job, is to provide the vision for their department, yet it is abandoned. And look, elective care is good. It's great to see, and I will commend the Trust and the Minister for the increase in elective care. But that is no good to you if you're sitting dying waiting on emergency general surgery. We don't mind travelling for elective care here when it's planned and we know we need it. Yeah, we'll take it local if we can get it, but we don't mind travelling. But we can't travel for this. And the final point I'll make, Chair, that's been made by a couple of other councillors and latterly Councillor Deehan there, is yes, we do need to engage with all the bodies to try and get a solution here. And the Minister needs to act, Chair. Thank you.
Okay, thank you. And you've summed that up well, and everybody across the chamber is in support. So, yep, unanimously agreed. So that's that. Yep. So we'll now go over to Barry and Catherine, and with your motion, and you've got 5 minutes. Oh, let me just put you on. Hold on. There you go.
Thanks very much, Chair. Making sure that the Strudel shared education campus, shared spaces are welcoming and representative, is the title, you could say. And the motion calls for dual language signage, Irish and English, internal and external, at the Strudel Shared Education Campus in Omagh. It also calls for adequate provision of Gaelic or GAA pitches. And what I'm doing here is I'm following the evidence and I'm following the lobbying within the community. This didn't come from nowhere, this rune. So, Tashi, ask Gaelic Chomai. You'll see that it's in Irish as well, the motion, and perhaps the most important section in the motion. I'll say it in Irish. We're trying to Kinchu Gome ar Spasna Corincha Filchak August Tamajagere Leru na Pobble ar a Vrastlian Shid Erin and Corlia Shaw Gogurfer Corhiact Da Yangak last year August last Mui ar File ar Campus Corincha Educus Nasruha ar Nomi. So I'm a supporter of the Strudel campus. I think we all are. And there's tremendous community consensus around this. It's about the future. It has been described as an iconic project, programme for government commitment, an executive priority, a flagship project in the pipeline now 15 years. And it's taken shape, schools are nearly built, they're nearly up. And I would like to congratulate Woodvale Lowry joint venture on the work that they're doing there under the auspices of the Department of Education. We all know it'll open in September 2028. Arvely is already in place, fantastic school, and 5 additional post-primary schools will be located there, will be domiciled there. Omagh CBS, Scoil na Maraher Christie Ernomwe, Sacred Heart College, Loreto, Omagh Academy, Omagh High. Drumra integrated and Irish medium education will not be effectively on the campus, but obviously Irish medium education and integrated education will benefit from the shared education approach, the entitlement framework and the sharing that is to happen. So I was speaking yesterday to some people in Omagh, and they reminded me that there's 3 of the schools will be close on or above 1,000 pupils. There's 2 schools, if I go to the Gaelic pitch adequacy, there are probably 2 schools of the 6 or 2 of the 5 that will join, where the principal pitch sports are rugby and hockey. And the other 3, the principal pitch sports would be Gaelic games. That would be Gaelic football, hurling and camogie, and ladies football. And within a 15-mile radius of the campus, there would be 23 GAA clubs. Some of them have in excess of 1,000 members. And we're talking here about community use, but also the young ones who will attend the schools there. I think there's 1 or 2 hockey clubs and there's 2 rugby clubs. So I think the rugby, soccer and hockey pitches are to be regulation size. The GAA pitches are only to be sized for youth teams, not fit, for example, even for a Macrory Cup match. So I'm seeking confirmation from the Department of Education that Irish language signage will be installed in the shared hub or other shared areas of the campus. If you look at the status of the Irish language, it's an official language, official in the courts. There's a particular onus on the Department of Education to promote it. And there's a strong Irish language lobby. I mean, Pobble Erinule is an umbrella group for Irish language groups in the Omagh area. And they're lobbying very, very strong here. But they feel as if they're getting nowhere. And what's the point in consultation if they're not going to be listened to? There will be feeder Gael
20 seconds left, Barry.
Okay, there will be feeder Gael Scolna, Gael Scolna Gran, Strabane, Carrickmore, possibly Fermanagh. And visibility is needed, so I'll come back to that whenever I have another opportunity. Thank you.
No problem. Catherine, do you want to come in and second? Oh, let me turn you on, otherwise you can't. There you go.
Gurmayagad Caherly, thank you, Chair. It is amazing to see the incredible progress on the Stroud campus, with almost 40% of overall construction and 50% of school buildings complete. This is a hugely impressive project with up to 1,000 local workers on site, giving a massive boost to the local economy. The shared education campus will bring approximately 3,800 children from 6 schools together on one campus, learning alongside each other in world-class educational facilities. Le Blinta Bioga Anuas, Ta Avakan Culture has Suntasak, Feka Eger Pobble, August Ta Fos, Nagiliga, Eglanyanch, Ai, Egolonyart, Gunyart, Fud, Nasuki. In recent years, our communities have witnessed a remarkable cultural revival, with the growth of Angelica continuing to gather momentum across society. Our Indigenous language is a shared part of our heritage, and its continued resurgence is both encouraging and something we should all take pride in. The Irish language belongs to us all. Dual language signage will ensure that our shared spaces are truly welcoming and reflective of the communities they serve. Gaelic games are woven into the fabric of life across Fermanagh and Omagh. Every weekend, our clubs are filled with children and young people developing not only sporting skills, but confidence, resilience, teamwork, and lifelong friendships. For many families, Gaelic games are not simply another sport, they are a central part of community life. We are asking for adequate GA pitch provision that reflects the sporting interests of the young people who will use this campus. Sinn Féin has long campaigned for this major project to be delivered for the benefit of young people and families across Omagh and across West Tyrone. The visionary and ambitious Stroud campus will be a game changer for young people in West Tyrone and beyond when it fully opens in September 2028. Ninyart Gokar Lakela Arai Lynn Gurmayogov.
Thanks, Catherine. We do have an amendment. I'll let you in quick there, Bernard, and then we'll take, because there is an amendment to this motion. Do you want to wait until we've heard the amendment?
Mm-hmm.
Okay. And he gets 5 as well, no? 3. Okay, so John and Rosemary, and you've got 3 minutes each with your amendment.
Okay. Thank you, Chair. I'd like to thank the proposer and the seconder for the motion that they have brought forward. This, they've adequately covered the uniqueness of this site and its importance to the Omagh area. With the links in Omagh, with Alice Milligan, and WAF and RL Marshall, it's only right that the signs in this shared campus should reflect the 3 languages. So that's why I've amended it to tri-language. I believe I've seen it happen in other locations and it works well, and I believe it should reflect that. It also gives a sense of ownership to everybody and also a sense of respect which may pass out into the wider community. The sports complex gives a unique opportunity to enhance not only school facilities, but those for the wider public and community. Given the many interchangeable scales, I believe the site has the potential to be a centre of excellence across the many disciplines and sports codes in all abilities in this unique shared environment. As Councillor McElduff has pointed out, the pitches and facilities must be to the proper standard, and that includes pitches with the capability of hosting McCrory Cup and Schools Cup matches in the various codes. So I'm not going to continue any further. I believe that the motion has merit, and I believe with the additions that I've added, it will be a unique site for everyone.
Okay, thank you. Rosemary?
Thank you very much again to the councillors that brought this motion forward this evening. In seconding Councillor McLaughry's amendment, I believe it's most important that all major sports are not only recognised, but adequate facilities for these are provided at the campus. Sports facilities play an important role in providing safe and structured environments for our young people. Access to a wide variety of organised sport and recreational spaces creates opportunity for social connection, teamwork, personal development, and stronger community, youth participation and engagement, which after all is what schools are about, and particularly now that we're building all 5 schools in the one campus. In relation to signage, the Ulster Scots English and Irish signage could act as a vital cultural, social and historical markers. They promote linguistic diversity, foster inclusivity, and ensure the territory is viewed as shared by all traditions. The integration of these languages, this tri-language, validates local identity and reflects the diversity heritage of Northern Ireland. So I will be supporting Councillor McCloughery's motion.
Thank you, Rosemary. Barry, do you want to make a comment now, or do you want to? We go make one later. There's nobody. Oh, sorry, Councillor Roof.
Thank you, Chair, and thank you to the councillors who brought forward the motion and the amendment. As a party, we look at the shared campus as solely that. It's a shared campus. I feel like both the motion and the amendment have validity, and in particular, we have to take into account that this campus as a whole has to represent Omagh as a whole. And I do firmly believe that the trilingual signage would do that, and present a unified front for this campus. So I would be happy to support the amendment. But equally, I think we should be, however it goes, I think we would be supporting across the board. Thank you.
Okay, thank you. Whoops. Go on. Errol?
Yeah, thanks very much, Chair, and thanks everyone for bringing the motion and the amendment. The Democratic Unionist Party will be supporting the amendment, but I want to make the following points, and I think the Councillor Barton in particular laid out what can be achieved as we move forward into a more modern era, with the children coming into that from September 2028, and we have to look to the future and embrace everyone. Just I want to make a few points, because I've been on this community stakeholder group from the very outset. Some people have been there and gone, and as a town councillor for Omagh, born and raised, I think it's a very important piece of infrastructure we're going to have in our town. The department currently provides Irish language signage for Irish medium schools. Where an individual English medium school would like Irish language signage, this is a matter for the Board of Governors to progress. Consensus amongst the schools is a key driver for decisions for the shared areas of the campus. The programme team will continue to engage with a range of stakeholders about this and any other matters raised relating to the campus. Now, we're well aware, and we had our meeting last week, which Councillor McElduff and Councillor McGrath and myself were at, and we know there's going to be a lot more engagement with more stakeholders as we move forward, and that'll be right across the board. Just with regard to the pitches, each pitch at Stroul is designed for multi-sport and flexible use, supporting both curricular and extracurricular school activity. The pitch provision was co-designed with the schools and their heads of physical education. This collaborative process ensured that the final layout reflected school need. The Stroul campus delivers a single, integrated sports provision model, replacing fragmented and inconsistent pitch access across the existing schools. I want to take this opportunity as well to commend Woodvale Larry joint venture and what they have done there. We were told last week that currently 600 people working on that site, and what a boost that is to the economy of Omagh and the economy of Fermanagh and Omagh itself, and indeed the West Tyrone parliamentary constituency. So with that, I hope that the amendment can be embraced by all here as we move forward. The Democratic Unionist Party will be supporting the amendment as put forward by the Ulster Unionist Party.
Okay,
Thank you, Chair.
Thank you. Bernard?
Thank you, Chair. The growth of the Irish language has been significant in recent years, and the demand for it is to be seen in our community is clearly seen in large amount of requests for dual language street signs seen by this council. The demand for GAA facilities is beyond question, and calls for more facilities in Omagh have been discussed by the council on multiple occasions in the past, so it would make absolute sense to expand access at the Stroud campus and to prioritise this delivery of this. The SDLP will be supporting this motion, and regarding the amendment, happy to support inclusion of Ulster Scots and all sports being catered for, and would be supportive of it. Thank you, Chair.
Okay, thank you. Josephine?
Thank you, Chair, and thanks to Councillor McElduff and Councillor Catherine Kelly for bringing forward this motion and for the amended motion. I certainly believe it's important to have Irish sign language in our Stroud Shared Education Campus, but I also feel that there is a place for Ulster Scots as well, because in my view, it is very important that there is a spirit of integration and cooperation, and I think that it will represent significant progress towards the establishment of a shared society. I do agree with Councillor McElduff that provision for GAA is not what it should be, and I think that that needs to be addressed. So I am happy to support the motion and also the motion as amended, Chair. Thank you.
Thanks. So thanks, Josephine. So I think we'll go, there's nobody else indicating, so we will go now to the amendment. And as we're going to go for a vote on the amendment.
Chair,
a recorded vote. Yep.
So this is the amendment proposed, Councillor McCarthy, second, Councillor Barr.
Okay, so this is the amendment proposed by John
second, Councillor Barr.
and Rosemary, seconded by Rosemary.
Disagree if that's okay.
All right, okay.
Take a copy of it after whenever you do your own. Okay.
Okay.
Just to get the numbers.
Yeah. Do I vote here? Do I?
Skip this room. Do I? It's 3. Oh, yeah, you're on there.
Yep.
Okay, so 14-4.
Okay, so we have
14-4.
14-4, 14, 11-4.
No, 14, 11 and 3. Sorry.
Oh, yeah, sorry. 14-4
16 again.
and 16 against and 1 abstention. So therefore, the amendment is defeated.
Now you go to Councillor Murphy.
So now we'll go.
Just don't touch the.
No, I won't touch.
You just need.
I don't know how to turn you on because I'm not allowed to touch your
We're
screen.
okay. We're okay. We just take care
There you go.
for the summary.
For a summary, please.
Okay, thanks very much. Thank everyone who contributed to the debate. As Catherine said, the seconder to the proposal, and I hope you don't mind me saying, Catherine, you come from a Drumragh Integrated College background. I know you're very proud of that. I just want to agree with what Catherine said about the strength of the Irish language renaissance. Fiochan na Gaeilge, fast na Gaeilge, can't be ignored, and we're promoting it actively. And I am genuinely, and we are genuinely following the strong lobbying of, for example, the Tyrone GA and Pobble Erin I want to point out that the Irish language has a high level of protection and promotion in this state. It's an official language. It's protected and promoted under Part 3 of the EU Charter for Regional or Minority Languages. We've identified where the deficit is. I respect the individual ethos that each school will promote within their own curtilage and within their own space, but in the shared spaces, we need to make this type of progress for the future. So I'm formally stating that I would like this motion to go through. Thank you.
Okay, thank you. There's nobody indicating, so we will go. Is everybody in support of the motion? No, so we'll have another recorded vote then. Yeah? Is everyone? Yeah, okay.
Should we do the committee first and then go back? So we just have to stop time really and look around. But yes. Just check over here with Michelle.
Oh,
3 and 2.
oh, yeah, right.
That's the
Three.
only people on the other side.
Oh, yeah, 8.
So it's 3.
No,
3, yes.
2.
That's 20 and 10.
So that's 4, isn't it? It's hard to say.
3.
3 and 2.
Yeah.
So that's 24, 10 against. So the motion's carried.
Okay, so the result of that is that 24 the motion and 10 against. So the motion carries. Yep. So thanks for that, Barry and Catherine. I do have a couple of issues under AOB, but it is 5 to 10. So we're going to go into confidential first. Proposed by Anne-Marie Donnelly and seconded by Councillor Eddie Roof, and then we'll come back to the AOB if we get through this in time.
And we'll tell us where everything is paused.
Oh, Rory, did you want to come in there?
Would we, Dale, would you keep us out just of, sorry.
Okay, thank you. Do you have to give a summary? Yeah.
Sorry, Chair, just to note, while in committee, the council confirmed and signed the confidential minutes of the special council meeting, the planning committee meeting, the environmental services committee meeting, and the policy resources committee meeting. And there was a matter arising from environmental services, which was noted. The council also noted correspondence from the Northern Ireland Local Government Commissioner for Standards, and also considered the update report on confidential estates matter and agreed with the recommendation. Sorry of that, Chair, proposed and second.
Yeah, can I have a proposer and a seconder for that, please? Nolene and Anne-Marie Donnelly, thank you.
Just take an extension of the meeting. Is that okay?
Okay, can I have a proposer and a seconder to extend the meeting? Thank you, Eddie and Adam, which is handy because it's you two that are going to be speaking. You've actually kind of emailed in the same issue, so we're taking it under any other business. So Eddie, yours did come in first, so if you can kind of make it brief, because I'm sure everybody's going to agree with you anyway, and then Adam, you can come in, and then we'll go to Barry's issue then. So Eddie?
Just if we ask everyone to keep the voices down, maybe.
Yeah, and if people are moving, can you be quiet, please, so that we can actually hear what's been said by Councillor Roof? Thank you.
Thank you, Chair. Yes, this is just regarding the ongoing strike issues at Balcas and the conditions and pay conditions that have been offered for the workers. It equates to a below inflation pay rise at a time when cost of living is very high. It's not in good faith, and I think demonstrated by some of the pay rises in similar factories and sites across the county. It just doesn't meet what is necessary. So I don't think that they're far away. I don't think it's a huge unbridgeable gap, but we need to see action. So I would ask if we could write to the owners, Glennon Brothers, both their headquarters and locally, offering support from the council for a quick resolution, and for them to come back to the table to speak to the workers to resolve this for local workers. It's a huge employer in the local area, and we want to see this resolved for everybody. Thank you.
That's lovely. Thank you. And Adam?
Thank you, Chair. And as you said, the same issue, and like others in this chamber, I joined the Balcas employees on the picket line and listened to their concerns and the issues that they had, and boy, they don't do an easy job by any stretch of the imagination. And they're a huge employer for this area, and I think the staff were clear that they wanted the council to support them in trying to get negotiations reopened with Glennon Brothers. And when you have £50,000 roughly, actually over £50,000 of profit, and that's pure profit per employee in your company, to me it would only seem fair to give them a fair share of that. But I'm happy to second the proposal that we write to Glennon Brothers. I do think an amicable solution can be found here that the workers are happy with, and that, well, maybe the employers aren't so happy with, but will accept as well. Thank you, Chair.
Okay, that's lovely. And so we've got a proposal there and a second in support of the broadcast workers. Is everybody in agreement? Yep, that's good. So Barry, now over to you for your issue.
Okay, so I wrote to you this afternoon, Chair, and it's to provide an update um,
Can,
on a flooding.
sorry, councillors, can you just be a bit quiet, please?
Okay. So I know that Councillor Kelly and Councillor Thompson will, this will resonate with them because we collectively lobbied on a particular matter. Some months ago, whenever I was chair, I introduced one of the meetings with a reference to a site meeting that we had held in Oma earlier that day. Councillor Kelly, Councillor Thompson and myself, with Paddy Devlin. And Paddy was excellent on the topic, a real expert. But there's probably good news here, and Paddy deserves the biggest amount of praise, I would think, for his persistent lobbying, him and the Campsie / Lower Market Street property owners who were affected and have been affected by flooding in that area. But there was a meeting in mid-June, and I was able to attend it in County Hall, Oma, with the residents, led by Paddy, and we met with Robert McCartney, DFA, Harry Gallagher, DFA, and we were hugely benefited by the presence of geohydrologist Les Brown, who's within this council area. And essentially, DFA have confirmed their intention now to install permanent pumps in the dry arch and hopefully to have the project completed in the current financial year. So that was great news, and they have the budget ring fenced to do this. Now, listening to Mr. Devlin, who led the lobby, he's saying that after 15 years, we might now have a resolution that will dramatically reduce the potential risk of basement flooding in Lower Market Street. The plan is to install 6 permanent pumps within the dry arch, and they will be to a depth of 2.4 metres. And that's approximately 6 feet lower than the existing sumps they use. So that was the tenor of the meeting. There was a lot of technical stuff discussed, but people are obviously nervous about upcoming weather events, perhaps in the autumn and winter. But there is hope there. So as well as providing this update that I'm aware of from having attended the meeting, I would propose that we write to DFA just seeking confirmation of that decision, and essentially what we're doing here is we're amplifying what the local residents are saying themselves, led by Paddy, and a lot of appreciation goes to him, but no harm in us as a local government authority getting that confirmation in writing as well. So I'm proposing accordingly.
Okay, thank you. And Catherine? Oh, sorry,
I think she switched off.
That's it.
Thank you, Chair. I am happy to second Barry's proposal. I as well have attended site meetings with Paddy and residents down through the years. And I'm so happy that they're finally seeing progress on this issue. This is something that they have been fighting for years. And I would like to commend Paddy and the other residents for their persistence on the issue. Thank you.
Thanks, Catherine. And Errol?
Yeah, thanks, Chair, for letting me in. And I want to support it has been proposed and seconded by Councillor McElduff and Councillor Kelly there. And I want to pay tribute to Paddy Devlin. We had a good meeting that morning. Unfortunately, I wasn't fit to get to the meeting in the County Hall, which took place. But I certainly lend my support to the letter coming as proposed by Councillor McElduff and Councillor Kelly.
Lovely, thank you.
Paddy, thank you.
Is everybody in agreement? Okay, thank you. That's it then. Safe home. A little bit of daylight left.
Yes, indeed, yes. Thank you, Chair.